Okay, thank you. We're going to start the special committee meeting. At 11 o'clock, we're hearing from Director of Labor. 12 o'clock, our homeless coordinator and behavioral health services administration, and then partners in care. At 1 o'clock, we're hearing from Dan Foley, who's a special master on the releasing of incarcerated persons. And at 2 o'clock, we'll hear from Director of Public Safety. So I know everybody's wearing their mask. We can have a fashion show, I guess, later.
We are social distancing.
Just that some people can't hear us.
Okay, thank you.
Okay, so Scott, good morning. Thank you for joining us.
Good morning. Thank you, everybody. I appreciate your time. So if it's okay, I'm going to start off just with a recap of where we are in terms of filings, and then maybe go through some of the phases that we've gone through to address improvements to our system. And then I did get the questions that you forwarded, so I'd be happy to answer those at that time and then take any additional questions. So as of Wednesday night, we have received in total 227,867 filings. Of those, 20,741 were replications. So that leaves the net of 207,126 filings that we've received. Again, that's a record number of filings. But to address this, what I will share with you is that we're gone through a number of phases of activities to address this. So I'm going to start back in March 18th when we started to realize some degradation to our online filing system. So the first phase was between March 18th and March 23rd. And during this period, we addressed the system degradation that we realized by creating an online form. And this online form would then provide claimants with the opportunity to file their claims 24/7, and we would ingest them into our mainframe. Because as I shared with the committee and with the public, the problem that we were experiencing on March 18th was that the mainframe was taking too many calls from our claimants. We're taking upwards of 3 million calls an hour. And the mainframe was never designed to do that. It was designed to do processing. So the creation of the online form solved two problems. One is it allowed claimants to file 24/7, and it allowed us to control the traffic that was going on to the mainframe. In addition to that, during that time, we also started to address the code in the programming of our UI system. We started to remove some of the logic that was increasing the number of calls to the system. So these were verifications that the system would make, which we believed we can catch on the back end through post-audit. So that online form system, as well as some of the changes to the code, happened during the weekend, I believe, of March 21st and 22nd. On Monday, March 23rd, we launched not only the online form system at about 2 p.m., but at 10 a.m. that morning, we launched our first call center. The call center was staffed by 38 employees of the Department of Labor from different divisions within our department. That was our initial redeployment. And again, that happened on Monday, March 23rd. So that got us through initially the bulk of some of the filings. Phase 2 started on 3/26 and ran to approximately April 6th. And what we did during this time is we started to address the reduction in time between the period in which a claimant can get paid. As I shared with you, by our federal window of payment requires us to pay within 21 days. Prior to COVID-19, we were hitting that mark about 85% of the time. I did share with the public concerns that we had of meeting the 21-day period, and at that point, we still couldn't commit to a specific time period, except to say that we were working everything we can to reduce the time to payment for our claimants. Phase 2 also involved it started with the systemic cleaning up of our system and how we could address some of the idiosyncrasies to streamline things. But we also looked at expanding our call center. So on Monday, April 6th, our call center in Kaka'ako at the Entrepreneurial Sandbox went live thanks to the support of HTDC, as well as the Hawai'i Community Foundation, who provided us with the laptops. We also launched our claim center in our building in conference room 310, which was our previous call center. And we also launched the technical support center. On Monday, April 6th, we also redeployed or redistributed an additional 38 staff, bringing our count up from 7 claims personnel to, oh shoot, I gotta do the math on the fly, 83, a total of 83 personnel from within DLIR and our attached agencies to help address the increase in claims and the number of calls that we were receiving. And those things are all live now. So the accurate number of staff that we have deployed throughout our division, including attached agencies, now 76 personnel. Phase 3 started on April 7th. And what phase 3 looked at was, okay, we're going to be having this increase of claimants come in, of staff come in. So where are we going to put them? So we have been in discussion with the Hawaii, with the state library system, and looking at deploying another claim center within the state library. We're looking, our target date for that is to roll it out on Tuesday of next week. Sorry, I don't have that specific date, but Tuesday of next week. Let's see, we're also looking at the possibility of expanding our call center and setting up another one, but we're looking at the viability of setting up on another carrier. And the reason for that is, I believe we're starting to tax some of the infrastructure that we already have. If you remember this past Monday when we launched the call center, it went up. We couldn't launch it right on time, and the reason is the call center wasn't able to take the volume of calls. On Tuesday, it was okay, but on Wednesday, it started going down again. And so what we found out was there was a 3 meg line feeding into the Kaka'ako area, and that trunk had to be increased to 25 megs. So we did have the support of Hawaii'Tel help us with that. But clearly, you can see that we may be starting to tax one carrier's infrastructure. The idea behind going by a separate carrier is that it will allow us then to diversify away some of that risk and ensure that we're spreading the load over 2 separate systems. Let's see, the other thing we're doing is, we have made a lot of changes to the system, or some changes technically to the system that I've tried to put in an illustration that I'll be going over when I answer the first question that came up. But we are speed testing that now. We actually have a claim going through, a legitimate claim that came in through an employee that we are actually not one of our employees, but a relative, I should say. And we're speed testing it to make sure that we can hit the reduced amount of time that we are looking at for what I have to say is a completely clean claim. So it came in with all of the right information. We were able to get it in not only to the form, we were able to ingest it timely into the mainframe. It didn't append on us. And then subsequently, we're timing how it gets through all the staffing, and to the point where we can then confidently say we've reduced the time from 21 days to at least what we're trying to get down to right now, which is 14 days. That's kind of where we are at this point, and what we're looking forward to next week. The accurate date for Tuesday is the 14th that we're looking to launch the new claim center in the state library. So that's kind of a recap. I'd like to, if it's okay with you folks, answer some of the questions that were presented to us, and hopefully we'll go from there. Oh, wait, maybe I should ask you, did you have any questions about what we've been working on up to this point?
Well, maybe I think you should go through this first, and then we'll follow up with questions.
Okay, we'll do. So regarding the first question on the concerns that it takes 21 days to get a claim in a check. So that 21-day window, again, is a federal mandate in which we need to perform in. And again, as I shared with you before, we were able to hit that about 85% of the time prior to COVID-19. So I'm not sure if you can see the screen that has the COVID-19 claims processing for clean claims. This is the PDF that I shared with you, and it has a small flow chart on it. So I'm going to quickly go over this chart that will highlight some of the changes that we've made to the system. So everything in purple is a systemic change. In other words, we made it to the system. Everything in green is the manpower changes that we've made, and where we see manpower changes helping reducing the time to making a payment. So basically, the online form that you'll see in the upper left-hand corner, those were the forms that we created and implemented on 3/23 to help offset the load that we're receiving coming through our regular portal, which is the black area. So had everything worked to scale and we had the ability to manage everything would have been able to come through the portal system. But clearly at the load that we were seeing, it was unable to do that, which is what necessitated the online form. So since implementing the online form, we also have deployed the employer match. And what that does is part of the monetary process, make sure that when an employee submits or a claimant submits a claim, we engage it with the right employer so we capture the experience rating requirements that we need. Now the system, even though, and I gotta make this clear, employers are not being experience rated for COVID-19. But to validate the claim and to ensure that the recipient gets the maximum amount of money that they're entitled to, we have to still make this employer match. So I want to reassure the business community, what I said before is true. You are not being experience rated on the claims that we're seeing for COVID-19. So those were the changes we made. Again, we did staff that with an additional 76 personnel that were redistributed from within, internally from within DLIR, and most recently with the support of our attached agencies. The other thing that we are able to do is, if you look towards your far right of the form, you can see the LER process. That's our low earners report. And what basically what happened is we would send out the low earners report to an employer to verify on every claim that we received. The employer would then have to verify it, and if they did not verify it within 5 days, we would then make the payment based off of the claim that the amount of pay that the claimant said that they made. So we reduced that now to 0. Those are the changes that we did to the system. So by making that change, we reduced the amount of days from 21 days to 16 days. Now, the other thing we did was, we're looking at in terms of a benefit payout, is right now just looking at the minimum benefit, and as long as somebody qualifies, we pay them because we realize cash flow is an issue. Then when we go back and do the further assessments of it, we can catch them back on additional pay. So what that is our estimate is that it took the weekly benefit determination amount from about a five-day period down to roughly about a 3-day period. We believe that as other staff come on and they gain experience in working with the system, we'll be able to see higher levels of time savings here. But our initial estimate is that it would be about 2 days. So what this flow chart tells you is that the systemic changes that we're talking about making are not just based off of the technology changes that we're implementing, but they're also based on the anticipated savings that we're going to see in manpower. Put this together, we're looking at a 7-day savings to reduce the time from 14 days for a clean, again, this is just a clean claim that has all of the right information in it. That would be reduced to 14 days. That doesn't mean that we're not looking at other areas yet, but this gives you an idea of where we're at now. So at least, again, this is the system that we are speed testing now. We do have a claim that's gone through clean. We know that the claim was filed on Tuesday. We did not ingest information on, what is today? Today's Tuesday night. Today's Wednesday. I'm sorry, I'm so mixed up already. Today's Thursday. Oh my gosh. Okay, so we did not ingest information on Tuesday night. But the claim was ingested on Wednesday night. The recipient did get their two follow-up emails that they should have received. So we are using this claim to help us improve all of the messaging along the way, because we realized that in making the changes that I talked about in the 3 phases, we just did not have the time to go into the idiosyncratic messages that our system says, which is causing a lot of confusion in the community. So we realize that, and we're trying to address it now that we've made these systemic changes that ensure that we can at least pay things for clean claim in a more timely manner. So that's
your first,
where we
okay.
With the first question.
Okay, wait, I'm going to interrupt then real quick. So
No, please.
For the members and I guess those watching, the 5 questions that we asked the director were basically, what can we do to reduce the 21 days? So that's what he just answered. And
yes.
There's some technology involved, as well as he's really going to need manpower to help reduce that. And then there's 4 other questions. Can the online system be updated or changed so that when people apply online, they can automatically accept it and payments can begin? Is there a plan to start asking for staff from other departments, and how will they be trained? How will DLIR implement additional benefits eligible on April 2nd, 2020? With new benefits and expansion of unemployment insurance, many employers and employers feel uninformed on their rights and obligations. And how is the department assuring applications are accepted? So I read those out. He can answer them, but why don't we take a break and let members ask questions first? Senator Kim.
Thank you, Scott. A lot of people probably watching and listening are concerned about the fact of when they're going to get their checks. And I know you went through this whole long process to make it simple. Of the 27,000 plus of filings, have anybody from that filings received checks yet?
Thank you for the question, Senator. So the answer is yes. And here's how we know. So on the back end, unfortunately, the system doesn't check. The system doesn't allow me to check aggregated cohorts of claims that come through. So in other words, I can't take one date and say, okay, these are the claims that came in this date and follow it through the system. So once that gets ingested into our mainframe, then I look on the back end to see what's actually happening on the pay. So I used the 21-day mark to kind of get a sense of what was happening. So for people who filed on second,
what percentage of the people got their checks? What percentage of the 27,000 got checks?
Yeah, that's hard. I don't have that specific type of information. That I can't help you. That I can't answer directly. What I can tell you is that the pay that we're seeing, the amount that we're seeing is increasing significantly.
Okay.
So
when do you expect all 27,000 to get a check?
Which 27 are you speaking about?
All the filings that have taken place. When do you expect them to at least receive a check?
The 205,000 claims? Is that what you're speaking about?
Well, you mentioned 27,000 was the total filings that you got since. Wait. I'm sorry. 207.
Oh,
207,000. I'm sorry.
Okay. So the 200 and the net out of that, if we remove the replications, comes out to 205,000.
Okay.
And it's difficult. 205,747.
Okay.
So it's hard to say exactly when. I'm sorry, I wish I could answer that question, but in all honesty, I cannot, because they come in through different dates. They've started from March 1st. So the best I can do is I can look at what the filings were starting in March and take it out in the 21-day period that we normally check and see how much money was distributed at that date. I wish I could provide you with more specifics on it, but unfortunately, that was the limitation of one of the reporting and data elements we got out of the mainframe system was one of the limitations that was associated associated with this system.
So when is the first 21 days then? When do you hit the first 21 day mark where you can?
So the first 21 days came up on March 23rd.
Okay.
And on March 23rd, the weekly pay for that week was 27% higher than it was in February.
Okay, but going back to Senator Kim's question of those who applied 21 days previous to that,
I cannot tell you what percent actually got paid. That's the problem. The system doesn't track that cohort all the way through. So what it'll tell me is this is the amount of money that came out and paid for a number of weeks, but it doesn't tell me how many claims that's associated with. Because the claims could pay, the weeks could cover people who had back pay, they could have, right? They could have multiple factors in there.
How do you ensure that everybody gets paid then?
I'm sorry?
So how do you ensure that at some point 100% of the applicants that are qualified are paid?
So we can individually track claims to the system, but I cannot take a whole group of claims that were filed on March 2nd.
So if someone has to call then, if they have to say, I'm sorry, I didn't get my check, they call you, right? Then you can check individually if they got paid or not. That's
exactly.
The only way.
Those are the type of calls they're getting.
Wow.
Right? We're getting. That's why the calls are very heavy, because we got to check individually with each claim, and that's why we wanted to modernize the system, and we're working with everybody on doing that. But that's the limitation that we have with the system now.
So in lieu of technology, the only way you can do it is manpower then.
Okay.
I'm sorry?
In lieu of updating the mainframe right now to deal with the current situation, the only way you can overcome the timeliness then is more people?
Yes, that's absolutely true. It's the only way I'm going to get the problem down.
Okay, can we get back to the more people? One last question, if I could. At what point will these filers and these individuals receive the added amount from the federal government? At what date can they expect their checks to include the additional amounts?
So we had received the guidance on the $600 plus up. So what I was told is that in the past, when we did do a plus up like this, I think in 2008, it was for $25 a claimant. But what we did was we did it manually. So we just don't have the manpower to do that. We are trying to automate that process now. And the reason is we know two things. That for the extended benefit period of 13 weeks and for the $600 plus up, that claimants don't need to follow anything, that we should be able to automate that. So we're trying to automate it now and implement the guidance on it. But for right now, we're just trying to get the original claims through. Yeah. So it's at this point, it's really hard. I can't even guess as to when that's going to happen. I wish I could provide claimants with a better answer than that. But I would be disingenuous if I just guessed at it. So just be honest, I can't tell at this point. We're still going through the guidance and we're working as diligently as we can through it. We are trying to automate the process because clearly under a pandemic situation, we can't have people filing in things manually. So we are trying to work that solution out. And as soon as we know, we certainly would want to share that with the public as well.
Okay, Scott, we have a lot of people out there that have no clue how they're going to feed their families and how they're, what date they can plan on, how long they have to scrimp and save on whatever savings they have. So this is so important. So you need to really get the information as to how many more bodies that you need so that we can at least augment some of this that's going on to assist these individuals. And so we have identified 706 people that can be redeployed.
Plus our 40.
Plus we had 40 that we had volunteered up to help and were turned down. Right? Who was it turned down by?
Linda.
I guess the chief of staff, Linda Takayama, turned it down that can help. And some of them may need training, but some probably probably don't. If it's just phone calls, because I just got an email now on somebody saying they're worried that, their claims are not being processed and they're able to get back paid, and they're not even sure if that confirmation went in after they submitted a claim. No phone call, they can't get through the lines. So some of these calls can be made by people at home if they got the list or something.
So, thanks, Senator. I would, to answer your question, we have put in a request for 58 additional staff, and I know that we're working with Kurt on that. I will tell you that part of the challenge that we had in deploying the technology is that what we find is that anywhere they call from, they're going to call back those numbers, and that's why we couldn't just deploy it from any other location, which is why we had to use more this organized type of a way. I will tell you, and we are working with the library system, and on Tuesday, our plan is to actually start training about 10 of the library staff as well to help us with the claims process. I will, I'm not sure about.
That's good that you can do that, but I think you're going to need more than 58. And when people file their claim, don't you can generate a list that you received the claim and send that list to people at home that they can at least call the claimants to say, yes, we've received your claim?
Yeah, we do have an update on what on the claims information, right? And a lot of the I can tell you a lot of the calls that we are receiving now have changed. They used to be about the status of their filing. They used to call us about how do we file. They used to call us that the system isn't allowing them to file online. The calls now are changing to exactly what you're saying. What is the status of my claim? Some of them say I got my email. Others will say that, hey, am I going to get back paid because I wasn't able to file my claim on time? So we've been trying to message that out clearly to the community, that those are the kinds of questions we're getting, and we're trying to answer it with the community through the media. I will tell you that part of the trick to this, right, is that the individual needs to then log into our system. So let's say somebody calls in with that type of question. Our employees have to log into our system and actually physically verify what that claim is. And so they actually have to log into our mainframe to do that through our unemployment insurance admin account. So that requires additional technology other than the phone call to be able to do it. And which is why we're trying to deploy these things in areas in which we can control that and we can give access to it.
Okay, but
I will tell you that.
Scott, is there a process right now going on for some emergency procurement or working with Doug Murdoch's shop in trying to help you get this and have a separate team working on that while you deal with the urgent need? Because I think it would be too difficult for you to be trying to do two things at the same time. If Doug Murdoch's shop can help you guys with the upgrade for these technologies, get some emergency procurement, and you continue to do the servicing so that we can get this thing modernized quickly.
Yeah, I would tell you that Doug's shop, the ETS guys, have been nothing short of phenomenal. They actually are the ones working with our staff on doing the $600 plus up, and they're automating the $600 plus up and the 13-week extended period of pay.
So they're actually on this. I guess what everybody is trying to figure out is when is it going to be clean? When is this system going to be clean and tight so that we can expect better service? And timeliness. Yeah. That's what everyone's trying to figure out.
So maybe this will kind of help. So for this week, we are seeing a decrease in number of filings. From actually Saturday of last week, the filings dropped to about 6,600. So we know the filings are starting to clear out. I can tell you that the number of claims that we receive that need callbacks because data is missing, that we're trying to call back now, is about 45,000 claimants. We know that those people put in a claim and the data needs to be adjusted, right? And we do know who those people are, and we do have people trying to call them. The other thing that we know is that we do have to do monetary checks on on the people who followed through the web form. We have automated that process now, but we don't know exactly how many people those are. But I can tell you that, the worst case scenario that we're looking at with following up is about 150,000 people. That's why it's so tough for us to do it. That's why at that point, we need people to help us, yeah.
No, I get that.
And
so there has to be two things going on at the same time. Some short-term remedy to get you people, to help you whatever short-term technology upgrades you can accommodate, and then the more, not long-term, but I guess the second, simultaneously upgrading the system so that you can deal with this more permanently.
Right, and I'll assure you that we are doing it simultaneously, right? That's why we're working with the libraries, and so and with ETS. So is the other thing that.
So is there a projected timeline? I mean, I know you don't want to commit to anything, but is there a projected timeline on how you'll be able to reconcile the technology upgrades and then contingent upon getting the staff that you need, because that's somewhat out of your control?
Yeah. Okay. So I can tell you that the idea that to answer your question, I can check with our IT, our UI staff. Sorry, I didn't have my normal UI briefing meeting this morning. I had another meeting.
No, so you can just maybe check with them.
What I'll do is I'll check with them on what the status is of automating the $600 payment. Because the $600 payment, you have to remember, right? Even though I can automate that process, I still got to get everybody's initial claims paid to put on top of that. So these are like stacking challenges, right, that we have. They're not one time get them in and you pay everybody. It's managing the whole traffic coming through. So that's why we're working on improving the communication, specifically on issues that we're getting back from the speed test we're doing on the improvements we made with the system, so that we know at what point we should be changing the message and letting the claimants know that, hey, it's not that you don't have a claim, right? It's at the process of being ingested or whatever it may be, right? So the answer is specifically related to their situation. I can get a better idea possibly of when these things are automated, what our time frame is on that. I apologize, I wasn't able to do that this morning. Normally we have 8 o'clock.
No, we can follow up with you late on maybe next week, because that'll give you some time to try to get those numbers.
Okay.
Dr. Marwaki.
Yeah. Hi. Good morning, Scott. I know you're under a lot of pressure, but the problem is also that people are stressing out because they don't know. There's this certification part of it where previously you've got to go through 3 employers. I understood that was waived, but when they go online, they seem to not know they're not being certified because of X, Y, or Z. They haven't gone to see employers, and I thought that was waived. Can you clarify? Because I see it on your flow chart as well. But again, it's the letting people know, maybe even on your website, this is the process. We're not going to go in 3 weeks or whatever, but this is what's happening, so that they know step 1, 2, 3, 4, what to expect, and not feel that they're in limbo, not knowing that they have a claim accepted or not. And that's even more stressful. Not getting the check is even more so. So is there some way that you could do some kind of information?
That's 2 questions. So going back to her first one on the certification, and then I guess her second one is some transparency or communication on the timeline.
Thank you.
Okay, so regarding the 3-day work search requirement, we've been sharing with the media too very clearly that is not required, but the question pops up, and the question refers to, are you able and available for work? All they have to do is say yes, and it will not generate an error message. If they say no, it'll pop up a error message, but that doesn't stop their claim. We still will process the claim, and that's what we've been telling the media, and that is what's on our website. That information is on our website.
I think that's confusing, Scott. So if it could just say some kind of instruction, either yes or no, you will be certified, or something like that, so that people don't know what to say, yes or no. So if
I understand that.
To clarify that.
So guess maybe I'm not making myself clear. We are trying to improve those messages now. But please understand, this all started for us on the 18th of March. All of the phases were implemented. So the question that we have to face, and this was, if this was not the right decision, I apologize, but I have to make a choice between making those idiosyncratic types of messages very clear or not taking the filings. And so I chose to take the filings. That was my decision. And I did that because I believed that we needed to get the filings into the mainframe. That's why up to this point, we've ingested 89% or 90% of all of the filings that we've taken, and they're on the mainframe that allows us to then get to the claims processing payment.
No, but you know, I mean, I don't think anyone's second guessing you. I think everyone appreciates your hard work. I think you're making all the right calls you have to deal with the situation. I think what she's asking for is some indication from the applicant that gives them some relief as to what they should be expecting.
And that's what we're trying to clear up now by individually at each point in the process trying to send the right message to the claimant, because that's what I could not do. That's what this speed test allows us to do. It allows us to make sure that the timing to reduce the payment to the individual is down to the 14 days.
So Scott,
and that along that process, all the right messages are coming out to the recipients. Because you have to remember, when they go online and they click these things, right, they get an error message that they cannot even get online. Those are the messages that we're trying to fix up now, to let them know that, hey, this is the status of your claim.
Yeah. So
and
if you,
there's
Scott,
very
Scott, if you had people to help process and get back to people, would that be helpful? If you need 100 people or 200 people,
he needs
can you put them in that part of the process?
So right now, yesterday, Riker had said you needed 87. You were able to get from your own department, you were able to transfer about 30. Is that correct? And
we transferred so far 76 of the people, but we still need the 58 that we requested from Riker.
Because I think that's what this comes down to. I mean, is that if somehow more people can get transferred over to you to deal with the backlog, or to deal with the outreach, or to deal with actually the phone calls, and that would help mainly. Despite having all this additional things on the website, as was mentioned, I think it's getting those people to you that will probably help most.
Absolutely, because you have to remember too that we did provide for Riker, and we are ready for providing for other support personnel exactly what the duties they would be, what the duties are that they were doing, what the skills are we needed, and these people need to be trained because our system isn't that simple. It's an old system that resides on a mainframe, and I tried to do it myself, and just trying to follow claims through goes through about 7 screens that you have to verify that's in an old, antiquated green screen environment. So, those are the things that we've made fixes to, that we're trying to, ensure the time payment to.
Modernizing.
But it's not that quick a remedy. It really does take time, and please understand that this is a ballot that we're playing. That I want to get money out to people as quickly as possible.
Yeah,
but there are federal compliance requirements we have. We're already getting calls from our business community saying, hey, you guys are being too lax with the ability to pay people, because we don't want to get an experience rating increase and then have to pay for this on the back end. We already know the fund's going to be so low that the schedule levels will change.
So the sooner DHERD can get you people, the sooner you can train them, and then because you're going to have, like you mentioned, there's going to have to be some time for training, and then that allows you the staff that you need to start to respond.
Yes. Training period is, we think it's about a day, but it takes time for the new employees or the redistributed employees, whatever we're going to call them. It takes time for them to get comfortable. And we were watching that and monitoring that within our own deployment of staff. Some of them are a little more comfortable because fortunately some of the staff within our disabilities compensation division have already been accustomed to using the green screen. So it's just, oh, okay, so it's a different screen. Well, other other people are coming on going, wow, what's this 14-letter password I have to authenticate with? So, you know, I understand the frustration, and believe me, I look at the numbers and I hurt for these people too. But we're trying to fix everything along the way that we can.
Appreciate all your efforts. I mean, if we can just urge DHERD to help in getting you people, then we really believe that would help. Senator Kidani?
Scott, thank you for being with us today and answering our questions. And I very much appreciate what you and your staff are going through. You're inundated. And I think one of the questions that we have, and I know you're talking about a system that's so obsolete, but can't the system be fixed to either remove the question that says, are you available for work, or that yes can be the only answer, or put a statement on there, answer yes? Could that not be fixed?
It requires us to go into the code, deep into the system, and to remove it. Whenever we remove things from the code, basically from my understanding of it, is then it goes into a test environment. We have to make sure that there are no long-term impacts on the back end, on the compliance portion of it, that then puts us in a greater risk of being out of conformity with the federal government. So it's not just a matter of switching these things on and off, that they're put in there for a particular reason to ensure conformity with the federal law. So, and if we don't do that, that's when we start risking some of the FUTA contributions that we get back from the federal government, which then would increase the burden on our state businesses, right? And that's why I appreciate the question. It really takes a deep dive into the code. If we can remove it, we certainly would want to remove it, because it clearly is a concern for the community. But it does have an opportunity cost that at this point it's very difficult for us to bear that, given that we could put personnel to other areas.
Thank you. Second question. We have many state employees that are considered non-essential workers and can't telework, so they're at home still being paid. Are you guys, how are you looking at that? Because I understand some of them are filing for unemployment, but they're technically not unemployed. Have you come across any of those instances?
I can speak to one. I did get one from a state employee who filed. The challenge is that, and what happened is it triggers this letter. I just want to make sure so I don't know, maybe it triggers a letter like this. And this is the notification that goes out to the employer. The employer then emails us back or notifies us back that yes, this person was separated from duty. So what happens is this case, it went to the Central Payroll Office, and then they routed out to the department that the individual was working at. So I did get a contact from our comptroller about this. What happens at this point is the employer would have to, let's say it was, I don't know, a Department of Labor, or a DBED employee or something, they would have to verify that yes, the individual was separated from duty, and that is what would trigger a benefit. So these are examples of some of the back-end tools that we need to make sure are maintained within our system. So I can tell you I know of one that are done. That's the only one that I've heard of at this point that has come to my desk.
Would it be helpful if all of the state departments forwarded to DLIR a list of all employees that in fact have been terminated?
At that time, we inform them of the program, and we can they need to go ahead and get whatever medication or whatever they need.
I couldn't hear that something was. We had some feedback. I apologize. Could you repeat?
So would it be helpful if all the state departments forwarded to DLIR all the employees who in fact have been terminated? Wouldn't that save some time? And I know you've said you only have one, but but if it's only one, then I guess it's not worth it. But, it does take time for you to generate a letter, send it, mail it, snail mail, to the department, and then the department gets back to you. That probably takes over a week. So I guess my comment would be that should you find more of these coming, that might be a problem. But I understand that there have been some discussion.
Yeah. So actually what helps us more is if the individual works with their employer to file. So I'll give you a very good example of how we work with the community on that. So Local 5 actually contacted us when they were looking at a large number of hotels shutting down, and they actually helped their members to file. I think IOWU did that as well with us, as well as I think Chris Tatum and the Hawaii Tourism Authority, they were reaching out to their employers to ask if they could help them file. And what that does is if we were to get that list, we would then have to input it ourselves, which would take more manpower away from us having to process claims. So if we get to that unfortunate situation where state employees are losing their jobs, then it would be best if the employer or the individual filed on their own.
Thank you. I don't think all the hotels got that message because I have a family member who was employed by the hotels and was not helped. And, she's already filed. I did help her file, but it did take 2 weeks to do it because of the issues that we're talking about today. Thank you. Thank you.
Senator Mawaki.
And Scott, so what about out-of-state employers, which I think there are a number, and the employees can't get in touch with their employer directly? What do they do in those circumstances?
Yeah, so as long as the employer match is there and they're not available, we would make the payment based off of what the claimant has filed as their income level and whatnot. So if we don't get the verification from an employer, we make payment for the claimant. And there's a lot that we anticipate happening. I'm sorry, Senator. There's a lot that we anticipate happening like that because a lot of these businesses are no longer in business yet. So, yeah.
Thank you. Just one more thing, going back to the number of people, and you said you did send to HRD the number of employees you needed and type of work that they're going to be doing for you. And if the number is larger, can you do something like 24/7 so that you can get people at different shifts so that you can keep this rolling because of the concerns really of people not getting paychecks at all and not getting any kind of support?
Sure. As long as we had, part of it is, it's kind of, I'm sorry, this is going to be a little bit of a waffly answer, but part of it is that we need to have staff from our department in there as well. So assuming that we would be able to create some type of rotating shift, the answer to that would be a yes, and I do think that would help. We would also need security and to coordinate it with other offices because we are running out of the sandbox now and we are looking at other locations to deploy call centers. So theoretically, yes, we could do it with the right number of people. Yeah, sorry, that's not a real clear answer.
But I think just getting the people there to you quickly, I think, is what we're trying to push as well. So thank you.
I appreciate that. Yes, thank you.
Senator Kim.
How long does it take for you to train someone?
1 day, right?
You know what? Yep. The training isn't that long. It takes about, from what I understand, it was about about 3 hours maybe. And I did want to, by the way, say thank you to Carol, Taniguchi. You guys did put together the training manuals for us, and that was very helpful. It really, I mean, you wouldn't think something like that, but it really did help out a lot. So we're using that training manual. I think it takes about 3 hours in the morning. We are still answering the calls. So what we did was we had people shadow the call center. That's why there were a lot of people at the call center on Monday. I think there were some reports that we just had people standing around. Well, part of it was a technical problem, but part of it was that they were training. So we did like a job shadowing type of thing, trained them with the training materials, and we released them to work on their own. The challenge, of course, is that the skill set that gets improved, we have a pretty steep learning curve, particularly on the claim side, which takes a little while for them to master. But as they do that, we see significant levels of increasing proficiencies.
So if you get the people you're asking for, 50 more, 85 more, what that number is, you can literally train them and get them working by next week, if you get them by next week?
Yeah, so that's the plan. So, and you know, I kind of wanted to make sure it was clear that you don't think we're going to then put our staff back where they're going to go. They will go back to their offices, but we do have access internally in the building to allow them to then remotely get into the mainframe and continue to help us with the claims processing.
Right.
So it's not like we're just replacing our staff, right? We're just relocating them back to their desks, ensuring the social distancing, and allowing them to do it. But yes, the answer to your question is that's what our plan is. We believe that we would be able to train them up, get them deployed. The sooner they get through that learning curve and start seeing improvements on it, I think the better it'll be.
And some of them can work from home, right?
Well, that part poses a problem for us, yeah. You know, because part of it is that the data is secured data. You know, I think there might be a way we could do that. But again, it depends if the main thing is if it requires a phone. If it requires a phone, then it's difficult. I know that people have cell phones and whatnot, but they have to realize that the number is going to show back as their home number, right? And that was one of the challenges we had in deploying things at other locations throughout the state. We needed it to show back this DLIR call center number. So if we could get through those types of technical issues, then yes, we'd be able to deploy it from home.
Okay, I'm sure, you know, this time of technology, having a number shown should be one of the least things we should be able to do. So I appreciate the work, and hopefully we can move a little bit quicker on this. So thank you.
Thank you.
Director Murakami, I wanted to let you know that the offer from the Senate still stands. You know, we do have employees that are working from home that, you know, we could lend to you. Also, we have conference rooms available that you could use as small call centers. We have an auditorium that you could use for training. So if the Chief of Staff decides that we're good people and can help just as much as anybody else, the offer is there. Mahalo.
Yeah, I appreciate that. And what I would suggest is, you know, we're trying to run all of that through DHERD. And the reason why we did it this way, and it's a good example of this is what you folks helped us with organization of the calls, right, and the inquiries that the Senate, both the Senate and the House had from our department. All of that got channeled through one vehicle now, and so, you know, we make whatever comes in from Kim a priority, and we answered that, and we focus primarily on answering those questions, because again, if you get all of these inquiries coming in, just like getting all these people in, right, we don't have them trained and whatnot, and that's where DHERD, we're hoping DHERD will really help us out, because they know what we need now, so that would be the most efficient way of getting us those people.
Senator Kehoe Kalole.
Thank you. Well, thank you, Scott, for all your work. We've said this to other people before, but please take care of yourself. You are one of the people we cannot have going down in this, and I appreciate all the work you've done and the pressure you've been under. We can, and I think maybe we should at some point have ETS in as well. But a lot of these mass fixes you need require IT personnel, like Senator De La Cruz asked earlier. Do you have enough support do they have enough capacity to help you with the electronic fixes that you need right now?
You know, working with Doug has been really, really wonderful. He's been very supportive, and, you know, I can tell you that for our end, I'm going to need more IT people. I mean, I have people here that are at 89-day hire that we're trying to bring on in this situation that are working overtime now for us because we just don't have enough manpower. I will tell you that our IT staff have been working, I think, well, not only them, but even our staff, you know, we all of March, went through March with the holidays and everything. I think we had one Sunday off. So it would help to, I think, have IT personnel as well. But I also know that Doug's going to need help as well. So anything we can do.
How many do you need?
disputes. I don't have that number, sir. We did do an assessment of both, of both that as well as the AWS workstations that we needed and some server environments that we would need to stand up some other things. I don't have that number for you, but I will get it for you for the next time. I can email it to you.
Yeah, because there are, whether it's assigning people from other agencies with IT experience or bringing on 89-day hires, or just even if it can be done effectively, getting people from the local community. The fact that we got HTDC to help really quickly stand up space at the sandbox, I think there's an opportunity to bring other people with that type of resource background online. And again, as Senator Kidani said, if we can help any way individually, I have lots of experience listening to angry people myself, so it's okay with the chief of staff. I can take phones myself, but thank you for that.
I really do appreciate that, and I have to say, a lot of the calls we do get are people who are upset, but a lot of them, I have to say, once we talk to them, they really understand. And what we understand is that it's not just a claimant, right? It's a person. So we try to understand what their overall issues are. So if they have issues about landlord-tenant kind of things, we try to advise them that, hey, there is this reprieve that the governor is working on for releasing, for rent release, and you can't get evicted. We try to help them understand the bigger picture of things. But I do appreciate that. Thank you very much.
Well, that's what I'm talking about, Scott, is please understand that each of our offices, I'll only speak for myself, but I'm assuming it's the same with others, we get dozens of calls a day. Asking for those simple explanations that Senator Moriwaki was referring to about how it's difficult to understand what's happening on your system. And I understand there are technical challenges and you got to make the decisions on how to facilitate those solutions. But we are already doing a lot of dialogue because our offices are being inundated by the overflow calls that you folks don't have the capability at the moment to follow up with, right?
Yeah.
So it's
I certainly
to keep
appreciate it. Yeah. And I appreciate you folks. I've gotten a lot of calls from other your colleagues, both on the House and the Senate, and they really have been supportive in helping their constituents understand the situation we're in. And I really do appreciate that, as well as the support from the press that we had, because we are trying to be as transparent as we can. And in my view, we've done everything we can to just honestly tell people what the situation is, which is why I'm very careful about not promising things that we can't deliver. I know it may be a source of frustration, but I cannot lie to people. I just got to tell them what the truth is.
No, we appreciate that.
Thank you.
So we'll follow up with some of the questions that you'll have some time to respond to. Senator Kidani.
Scott, for those listening on Olelo and YouTube that may still be trying to file their claim, can you answer a couple questions? When they first get onto the site, they have, on the first sheet, there's 2 green bars. Does it matter which one? Because my daughter-in-law was trying to do, for new claims, that button, the green button on the left side of the screen. And I tried the other one, and the other one is what got us in. I don't know if it makes any difference, but she was able to completely fill out her form.
I know if they click on the green bar takes them to our online form.
There's 2 green bars, but there's 2 green bars. One says claimant services, the other one says for new claims.
Oh, yeah, okay, I see what you mean. So the claimant services bar takes you to our web portal. And so that's the one that has the direct feed into the mainframe. That's the one that was causing us a lot of problems initially. So if you click on the other green bar, that I can't remember now what, first-time filers, that's right, the first-time filer bar, that'll take you into the form. And that's the one we've been using to ingest the data into the mainframe. And that's actually the route that we're speed testing now, because we know that people who are filing through the other one, UI claims side, that's the sign that they're having a lot of difficult time getting into it. They'll get bumped out of only because it has too much traffic going in with the certifications, with other types of activities that the mainframe is running. So that's the difference between the two.
Okay, thank you. I just wanted to let them know that we were a new claim filer and trying to help my daughter-in-law. She did use that claimant services, which was not what she was told to use, but she did get in, filed the form. At the end, when it says, congratulations, you've filed your form, it says, and you will get your user ID shortly. Well, that shortly was 1 week. So I think people should know that it does take a while to come, not expecting it to be almost instantaneously like most other websites would be. It is going to be a 1 week or more period. So they don't get back on the web again and keep trying to get in. And I think that might be causing you guys some of the congestion.
Yeah, Senator Kidani, if I could, and you're comfortable answering this, when did she file?
She filed 2 Fridays ago. Last week, Thursday, she got her claim number, but because she had gone into the claimant services and had completely completed the form, the response she got back was that her claim has been filed.
Okay.
Yeah.
Okay, I'm just trying to time it out in my mind with some of the things that when we made some of those other changes to the system.
Yeah, but she too was worried because all it says was you'll get your claim number shortly, and the shortly turned out to be a week. But
2 weeks.
Yeah. So just wanted people out there listening to know that.
Thank you.
Just to add on to that, Scott, because I've had a number of calls as well or emails that once they get the confirmation, whether it's 2 days or 1 week, they are in. Is that correct? They don't need to wait and keep on trying again, because I think that's also the confusion, not getting response back. Well, they have a hard time getting in, which you say is corrected now or being corrected. But just to know the process, that once they get that congratulations, then they're in. They're in the system. Is that correct?
They're in the system. Yes, that's correct. I think those types of individuals get in when they file their certificate. Once in a while, they get, the system won't let them do it because it's overloaded and whatnot. And those are the ones who are raising the questions about, hey, I got to file my certificate. If I don't file it on time, am I going to get all my pay? And the answer to that is yes, we are going to backdate it and make sure that they get the full amount they're entitled to. But yeah, that's a really good example of when a certificate issue comes up.
Okay, and that's good. So they should be assured that if they get the congratulations, they're in the system, and it will be backdated to the day that they became unemployed.
Yes.
Okay.
It might not all come at one time, but they will get the entire amount that they are entitled to.
Okay, I think that's good for clarification, because they feel if they don't get in to be filed, that they will be penalized, but that is not the case. Is that correct?
That's true. That's correct. What we look at is the day in which their employment terminated. That's the date that we use as a qualifying date for them to receive benefits.
Okay, thank you.
And do they have to file weekly or every 2 weeks once they're in the system?
Yes, the certifications require them to, initially, if you're entirely, I think it's a full benefit. We refer to it as full benefit. Then you have to file initial 1 week claim, and then you file a bi-weekly claim. If you're partial, which is somebody who is still attached and has a reduction in hours, that individual then has to file every week a certification.
Okay, but isn't that going to exacerbate the system?
It does. We do have a backup in the event that were to happen, which is to run a web form, another web form capability, and ingest data. But that's not our preferred way of doing it. It's not. So this week was the first week in which we saw a huge significant increase in the number of certificates. So we're assessing how the system is able to carry that and load balance it, because all of the certificates come in through our web portal and then into the mainframe. So they're actually making calls directly onto the mainframe. That's what we're trying to manage. Again, those large number of hits are what initially brought our system to realize degradation back in mid-March.
I mean, I think it all comes down to the fact that he still needs about 80 people.
Or more.
Or more.
I was just wondering if maybe
you really have to run down those claims. That's the thing, right? If you look at the form that we showed you, I'm going to click back here, but if you look at the forms, everything up to the monetary part and the weekly determination of benefits, that's where we're looking to put our people. That's where we need. The more people I can get, the better I can service it and run it down and get to the population that may be missing information, may have inputted the wrong information. That's really going to help a lot.
Because even for the guys who make mistakes and they try to go back, they have a hard time making any corrections, and then when they do try to call to get in to let you guys know that they made a mistake, they're thinking that they gotta redo the whole thing again. So a lot of them was doing that too. So if they made a mistake, thinking that you guys didn't get it or rejected because it was a mistake, they redid the application.
So if they made a mistake and they filed and they got the certificate number, then it's okay. They can go in and back in online and correct it. The challenge with that, again, though, Senator, is that the fact that there's just so many people, and that's what they get frustrated about. Yeah, they try to log in, and then even though they got their claim right, they just want to make this correction, and they cannot make the correction because the system is overloaded. So, we are again trying to address those things. This week we are trying to watch how the claim certifications are coming in to make sure that we ensure that the mainframe isn't getting overwhelmed. And I would like to remind everybody that mainframe doesn't just run our unemployment insurance claims. It runs payroll for everybody. It runs, I think the welfare system, DHS has programs on it, if I'm not mistaken. Other state departments run it. So my concern isn't just for, these claimants. I'm concerned about the welfare program going down and those sorts of things. So.
Okay, in your response to Senator Kidani on if this, not that, and if that, not this, I'm not sure if you guys have capability of doing a short video. So even some of the answers that you provided could be edited.
Right. So a couple of things, Senator. We do have an online video on how to file through the portal. We are looking at doing something similar to the filings, because those are a little bit different. And then the presentation that we sent to you folks, there are 2 slide decks that we sent to you. One of them is on the normal portal filing, which we had. The other one that we had to make and we're going to post up is the one on it's posted now, on the filings and what that process is. We're also expanding that to make it much more extensive. So, and then we'll look at doing something that's like a video or something. I know, thanks to, I think it was Lynn Kawano, she did a real nice thing on how to file and whatnot. So those things, you're right, they really do help, and we certainly will be working in that direction a little bit more now that we've been able to streamline the system a little bit more, and we're confident now that all of the data that we receive through the filings form are being adjusted properly.
Okay, thank you.
Quick question.
Senator Kim.
Scott, on the line, can you folks do like a voice message when people call in and they have to wait and hold? Can you do voice messaging or something, a recording for people on hold?
Yeah. One thing, that's a really good question, and here's what we're exploring now. What we found is, I think it was in Nebraska, that's right, Nebraska, what they did was they put on their call the message, the frequently asked questions that people are raising in the call
That's
center.
what I'm thinking. If they're
right?
on hold, you can actually say, if you're calling regarding a claim, this and that. If you're calling regarding this, give them information, because if it answers their question, they can hang up. They don't have to go through. But if they got to hold anyway, you might as well, have these short recorded messages of frequently asked questions that they can deal with and not have to go to the actual call.
That's a great idea.
Yeah, that's true, and that's what at least we're hearing from Nebraska that has worked for them. So we are looking at deploying that as well.
And an automatic reply as well. If you start getting on to the point where, yes, we've received your claim, automatic, and it can have this questions on it as well on the email saying, and if you're wondering about this, and it's like a one-time information that goes out to people. So you might want to consider that as well. Thank you.
If I'm hearing you correctly, Senator, I think there's two things. One is that we are looking at doing the message with the frequently asked questions. I'm not sure if what I'm hearing is like a phone actual call center where if you need help with this, click 1. That we don't have the capability.
No, that's not what I'm saying. If they're calling and they're on hold waiting for a call, a lot of times if you call like retail people, they have messaging to you about, sign up for this or blah, blah. You can give them information while they're on hold, and then it might answer their question and they can hang up.
Right. Yep. Exactly. That's the intention of what we're trying to do. Thank you.
I just have one last question. Are you also on the cloud, or are you only on the mainframe?
I'm sorry, can you repeat that?
Is your system also on the cloud or only on the mainframe?
So our system, our UI processing system is only on the mainframe. I understand that ETS is trying to actually migrate it to the cloud, but the actual processing center is only on the mainframe. The web form and our portal that connects to the mainframe are actually on the cloud. But the mainframe itself hosts our UI system.
Okay, thank you. Okay, well, we really appreciate all your hard work and your staff's hard work. I know they're taking a lot of, stressful calls, and the angry calls that Senator Keohokalole was talking about was more about the calls he's getting from his committee members. But thank you for all your hard work.
Thank you, Scott.
Thank you.
Thank you, Eric. Appreciate your support.
No, thank you. Okay, we're just going to take, why don't we take 2 minutes so we can get the next group up and running. Okay.
Eddie's here.
Quick recess.
Oh, my.
Scott, are you on? where did it go? We're about half an hour behind, but this is 12 o'clock. We're going to hear from the governor's homeless coordinator, the behavioral health services administrator, partners in care, and they're going to be talking about our homeless situation. So, Scott, do you want to begin with some updates?
Yes, thank you, Chair. So I can provide some general updates, and I know Eddie has put together a PowerPoint, so I can provide some highlights, and I think that he can follow up in more detail on certain points. But in general, our state strategy to address homelessness during the pandemic focuses on three main points. One, we're really emphasizing coordination across the various systems. I think we've had very close collaboration between my office, Department of Human Services Homeless Programs Office, and Eddie's shop within DOH in behavioral health services, as well as with the two continuum of care. So I think the coordination is really key. Second, we really focus on looking at our shelter system, working to implement social distancing in our emergency congregate shelters, and quickly putting options to address shelter overflow. And third, we really emphasize services to assist those who are unsheltered so that they can shelter in place safely in encampment. So I'll go over really briefly some of the things that we put in place. So first, on the coordination piece, my office, Homeless Programs Office, and Department of Health work together to establish something called the Behavioral Health and Homelessness Statewide Unified Response Group, or BHH Surge. And Eddie can talk about this in more detail. But in general, it's a forum so that we can coordinate communication across our mutual providers, because we have many of the same contracted organizations that we're working with. We've also started to fold in all 4 counties, the continuum of care, and also domestic violence providers into the TUI. So everybody can get information streamlined from one place. We have a weekly Zoom meeting with all the providers every Monday at 11 a.m. Our last meeting this past week went up to, in one session, more than 400 participants online. So I think it's a really good forum to get the information out there quickly to as many different people as possible. We're also utilizing that network to do an assessment of PPE needs across our various providers. We put in a bulk order, and as donations are coming in, we're able to use that list to distribute PPE out to providers based on prioritization. So for example, we received about 800 donations of masks just over the past couple of days, and we were able to distribute that out to the outreach providers on Oahu, as well as some of our emergency shelters, because those were the ones that we prioritized to have immediate need for the PPE, because they're most exposed, because they're working directly face to face with people, either in really tight settings or directly out in the community. So I think the formation of BHH Surge has been really helpful in order for us to really have clear communication with our providers, and then also better assess their needs. We've also used that forum to communicate to providers. We're really committed to giving them flexibility in their contracts during this time, that we've waived some of the requirements for specific performance metrics to allow providers to flexibly respond and have the flexibility they need to adjust to conditions as they change day to day or hour to hour. And Eddie can talk about the BHH Surge in more detail. Next, in regard to emergency shelter, as I mentioned, we've really been focused on looking at how we can address the tight situations in our congregate shelters, like the Institute for Human Services, for example, where you have a number of people closely clustered together. We've worked with the emergency shelters to have them implement social distancing practices within their facilities, and also give us numbers regarding what their overflow is. So as they maximize social distancing, what's the potential number of people that would be displaced? We've also had conversations with our transitional shelters, which have more individual units, so that we can shift individuals and families from our emergency shelter system into our transitional shelter system. So we work very closely with Laura Thielen from Partners in Care on that. She and her team helped us to get a good assessment of the transitional shelter vacancies, and we've started already to shift individuals and families from emergency shelter to the transitional unit, prioritizing those who have vulnerability and risk factors first. We're also taking some additional steps. So for example, we issued a subcontract between the Weinberg Village, Waimanalo, and Family Promise Hawaii to allow Weinberg Village to take in 5 additional families with minor children to increase shelter capacity for that segment of the population, and we were able to leverage private funding that Family Promise had. So it was a way that we could quickly, at very low cost, add 5 additional units for homeless families online. We also work with the City and County of Honolulu and Honolulu Police Department on the POST program that was recently announced earlier this week. And our office played a role in really reaching out to all the counties that we have Ohana Zone contracts with early on, encouraging them to look at flexibility within those programs to expand the use of certain programs so that we can better address the immediate need that we're seeing. That we then work with Department of Land and Natural Resources to get a temporary right of entry for the city and county so that they were able to set up within Keiki Lagoon Beach Park and get that up and running right away. So that was a key role my office played in that. We're also working with the other counties as well. So in Hawaii County, they're working to utilize hotel space in Kona specifically for homeless individuals and families there, and also working to purchase tiny home facilities to provide emergency sheltering both in East and West Hawaii. I think they're purchasing 25 units for East Hawaii and 25 units for West Hawaii. And in addition to this, we're continuing to look at a wide range of other options, including hotels and private facilities for potential additional shelter space, keeping in mind that, although FEMA reimbursement is potentially available, we're required to upfront a lot of costs, so we want to be really mindful of really seeing how we're going to be able to pay for that before we commit to anything. So I just wanted to kind of provide that caveat. And then as we address the needs in our sheltering system, we also looked at the need for quarantine and isolation specifically for the homeless community. And Eddie, I think, can talk about that in a little bit more detail about the Ka'ahi temporary quarantine and isolation center. But that was something that we got up and running really quickly in about a little over a week, and it was many partners that had a role in that. City and County of Honolulu, Department of Health, H4, Local 5, and IHS. So I think it's a good example of the collaboration that we're demonstrating throughout all of that. And then really putting in key protocols in place for infection control so that we're able to best utilize the limited number of beds that are there and reduce risk to those in the unsheltered community as we roll out screening and testing for that group. If anyone wants to access the quarantine and isolation site, that would be done through the CARES line to the Department of Health. And again, I think Eddie can talk about that in a little bit more detail. We also realized that as we're providing, or as space in our emergency shelter becomes limited, that we really need to provide more focused services to those who are unsheltered and living out of doors. And we've closely followed the guidelines from the CDC regarding homeless individuals encampments. And so there's 2 main things that we work on to better help our unsheltered population. One is we work really closely with DLNR to make sure that they could open up their restroom facilities statewide and keep them open 24/7 following the CDC guidelines. The challenge that we've had with that is that some of the restrooms have been subject to vandalism and are running out of supplies like toilet paper or basic cleaning supplies. We're looking at partnerships with the private sector and with community groups. We formed a very successful partnership with encampment at the Waianae Boat Harbor where we have a partnership with Twinkle and the Puhunoa Owainai, where they're assisting us in the cleaning and the maintenance of that restaurant facility there, and that's a model that we're looking to replicate in other parts of the city. We also have regular meetings with homeless outreach providers on Oahu to check in with them, see what their needs are. Out of the meeting we had last week came the need to really quickly assess where our large encampments are and where vulnerable individuals are in the large camps. So Laura and her team at Partners in Care were able to develop very quickly an online app using Survey 123, the same app they use for the point-in-time count, to develop a questionnaire so that outreach providers can utilize that and quickly identify those who are most vulnerable in the encampment, and we can use that information to assist the providers in providing direct services to them. We also continue to have similar meetings with outreach providers throughout the state. And lastly, although a lot of emphasis has been on the direct public health situation that we're in, we're also planning for the economic fallout that's going to affect many individuals that find themselves at imminent risk of homelessness. So I've also been working with Department of Human Services, looking at the rental assistance and utility assistance programs through the Homeless Programs Office. And that staff has been working very hard to provide more flexibility within those contracts. Specifically, one of the challenges is that normally those contracts require an eviction notice or a disconnection notice, but because of the moratorium, those are no longer being issued. So we've provided flexibility in the contracts to accept past due notices for those in arrears. We're also trying to expand the scope of those contracts so that they can cover a wider range of purposes, and are coordinating with Aloha United Way and other entities. They're also bringing online privately funded rental assistance programs. So I know I talked about a bunch of different things, but that's in general the approach that we've taken to address the needs of the homeless population, also plan for those who might be falling into homelessness in the near future, so that we're able to build out the foundation to support that population as well. And I'm happy to answer any questions the committee might have. Thank you.
I have a quick question.
Yes.
When homeless are discharged from Queens or any other hospitals,
Yes.
What's the follow-up on that?
In general, they work with the shelter system to verify that shelter space is available. And my office actually maintains a daily listing of the shelter vacancies, and we communicate that to Queens and some of the other health centers so they have that information available. Sometimes things don't always work as they should, but we have contracts with outreach providers that will ask them to follow up on individuals who are not able to quickly connect to something. And we also have a separate contract directly with Queens for emergency department assessment services through the Queens Care Coalition, and we'll flag any situations where people fall through the cracks to the Queens social work staff, and we'll work with them to follow up.
Okay, any other questions before we move to Eddie, or you want to go ahead?
So I wanted to know whether or not the proposed release of prisoners is going to impact, how that's going to impact the homeless situation now. Have you guys done any studies or have any numbers?
I believe, that issue is still being looked at. I have the same general information that I think others do, where they're looking potentially at up to a little over 400 individuals being released statewide. We have been in communication with the Department of Public Safety. They did identify a short list for us individuals who would be maxing out, so not necessarily those being impacted by the mass release, but people who would be released anyways because their terms are coming to an end, who don't have specific exit destination. So we have a short list of names of people who will max out over the next 3 months, and we're sharing that information with the providers so that we can plan to try and have options in place. We've also started convening, or actually joining in some of the meetings that providers have been having separately in the community to plan for a potential mass release, and trying to set up systems in place to quickly link people to benefits or to the shelter and housing options that are available. And I think Laura from Partners in Care has also been in some of those initial conversations and trying to see if there's a way to help look at options for housing through the coordinated entry system through Partners in Care.
So now, do you have a number, Scott? How many are maxing out besides the 400 that they want to release?
I don't. So on the island of Oahu, there's 20 individuals that would be maxing out over the next three months from 3 different facilities. So it's a relatively small number, but I think we want to make sure that we're planning for the exit of those individuals, and so we're starting to take early proactive steps on that.
Second question is, how many non-residents have you assisted in the past month?
There's been a relatively small number that I've become directly aware of, but I do know that there are individuals who are still choosing to come to Hawaii from out of state. My understanding is right now that there is a partnership with HTA and the Visitor Aloha Society, where they're paying one-way tickets to return people back to their original destination. Some of our providers on the neighbor islands, for example, Family Life Center in Maui also has some funding to return people to their original location. Just yesterday, I received a call from Maui about an individual who had come in to the state, to Honolulu in early April, and then had traveled to Hilo and then to Maui. And then they were connected to Family Life Center, and they were able to work to find a flight that same day to return the person back to their original destination. So that's a strategy we're trying to focus on for people coming in from out of state.
Scott, do you also have a phone number people can call when they see a homeless person that may be in need of assistance? And for us who work right across Queens Hospital, from time to time, we see what appears to be patients that have been released that are sleeping in wheelchairs outside on Punchbowl Street near the hospital.
Yeah.
And we don't know who to call. It takes us several calls before we get the right person.
Okay. So I can give the phone number to my office. My staff are still working remotely, but we're continuing to take calls from the public and triage those calls to the various service providers. So my office can be reached at 586-0193, or our email is gov.homelessness@hawaii.gov. And I believe, when Laura presents, I think Partners in Care could also be contacted for similar purposes. But what we do when we get those calls is we triage them to the service provider that assists that area of the island. Or, for example, with Queens, if we're personally familiar with some of those individuals, we'll be able to directly contact their case manager or social worker at Queens to assist us with the follow-up.
Thank you, Scott.
Senator Favela.
Since we're on the topic of our homeless people coming from the mainland, I know we had a system put in place at the airport years back, how HPD, DEA, and different law enforcement agencies would look at the manifest, and if the person was coming in from another state, did not not have a return flight, they'll be met at the airlines and questioned where they're staying, how they're providing themselves, which what the HPD is doing now. And the reason why I bring this up, because I do the night security for the DOE. 3 weeks ago, we had a gentleman from Alaska who came straight from the airport to Eva Beach. That's all he had said. He didn't say how he bought his ticket because he had no money. 2, he had no ID. So when we tried to get him someplace to go, he said he was just going to leave the area. So I know at one time the city was looking at putting in same thing that they did at historical in Waipahu in Eva Mahiko Park with the Oakland them, but it never came to be. But I understand they're concentrating on the town area, but the people in Eva Beach, Waipahu, Nanakuli, and Kapolei, they need some place for them to go to shower because our mayor, who said that he had opened up the parks and the bathrooms, is not truthful. All of our bathrooms in Eva Beach is closed and locked. So our homeless are urinating and doing all those other things in the street, and they're not having proper hygiene. And they said they're not going to chase them away, which is understandable, but they're still in clusters. In Eva Beach, Waipahu, and Kapolei, they're in clusters. So if they're worried about this pandemic spreading, wouldn't you think we'd be more proactive if having these parks open in the district instead of leaving it locked and saying that they don't have nobody to maintain these restrooms?
Okay, thank you, Senator, for the question. If you have specific areas that you've identified, if you can contact me and let me know, and then I can follow up with the city and county to see what the situation is with those restrooms. In addition, the weekly meetings that we've been having with outreach providers also include the 2 mobile hygiene trailers, Project Kia and Revive and Refresh. And if we get more information, we may be able to connect with them to see if one of the mobile trailers may be able to go out to these areas as well. So, let me know and I can follow up with you on that.
Okay, thank you.
Senator Moriwaki.
Thank you, Scott, for all the work that you guys are doing. My concern is they're still homeless on the streets. I don't know if they're the ones that are wanting homes or shelter that have been rejected because of the overflow from currently existing shelters, or whether they're the unsheltered that really do need to have some services coming to them because they are in clusters all over. In terms of my district, I see them still on the sidewalks, and I'm just wondering what kinds of services are there. I know we can call the hotline. HPD has its HONU, and we're going to hear about some expansion. But what kinds of things can be done as an opportunity so that we can help these homeless, unsheltered still?
The new POST program that the city brought up, I think, is an immediate option that can be offered. And just this morning, I know outreach providers were going out to different areas. I think I got reports that DLNR was working with some outreach providers in the Diamond Head area, actually sharing information about the POST program, trying to encourage people to take advantage of that. The challenge is that we cannot mandate people to go to those options or to emergency shelter, even if there are vacancies. So if people choose not to go, then our strategy is to continue to educate them about what they can do to keep themselves safe and to continue to build engagement and rapport. In addition to this, we're working with Department of Transportation, who has a contract to do maintenance, storage, and trash and debris removal. And so they're not dispersing encampments, but they are picking up the trash and debris associated with some of the larger encampments on state lands, so that we can address that public health aspect associated with encampments, so that we're able to still address the trash and debris that's accumulating, even though we're not dispersing the encampment. So those are a couple of things, and it really kind of depends on what the specific situation is. So again, if there individuals do have a specific encampment or group of homeless individuals that they can see, they can contact my staff at that number I provided earlier, and we do have somebody who's regularly answering that line now and responding responding to the public.
Is there anyone going out and assessing whether they're, like screening or testing of the homeless, especially those who are in clusters and, congregating close together? And these people who are coming off the plane, I guess the cases that we've heard about, the 4 that came off the plane and haven't been followed, that could cause a real stir among the clustered homeless.
Yeah, I'm sorry, I didn't quite hear the whole question. My phone line kind of broke up for a little bit at the beginning, so I apologize.
No, I think she was making more of a statement saying that the homeless who deplaned, who were not tracked, may end up socializing with maybe some other clusters of homeless, and she's afraid that may be a way that the virus could be spread because they're not being tracked.
And whether there's screening or testing of the homeless.
And then how do you screen in the existing clusters?
So I think that's where actually the app that Partners in Care developed, I think, will be helpful. So if there are people who have vulnerability or risk factors, we're able to potentially monitor those individuals through the information provided in the app. And then the app can also generate a heat map to track where we have large concentrations of homeless individuals in the community. So I think that's where the benefit of us partnering with Partners in Care and some of these other groups is really helpful in utilizing the resources to address those types of needs.
Okay, and then I'm sure Laura will have some follow-up. Okay, just quick question before we move on to Eddie. I saw in some jurisdictions that to help the homeless to ensure hygiene, some counties have put up portable water sinks, and other counties have put up different types of restroom facilities that are easier to watch just in case there's illegal activity. What kind of efforts are you aware of that we're still being able to provide some of the hygiene services to the homeless?
Again, we're trying to form partnerships with the community to assist us in keeping open the state restroom facilities that were open primarily at the Deolanar small boat harbors and at certain state park facilities, as well as the city and county restroom facilities. So that's one strategy we're taking. The second is we are looking into options to procure portable toilets and the type of water sinks that you're mentioning, but it's trying to look at what resources are available immediately to support that and upfront that cost. I have shared with some potential philanthropic partners that is a need that has been identified by some of the outreach providers. I think right now we really want to try and do what we can to support the facilities that are currently open and make sure that we can keep them well stocked and also accessible for those who need to rely on those facilities.
Okay, I guess as you get more information, then maybe. So as long you're not looking at it real piecemeal, you're looking at it. How can you get an inventory for areas across the state?
Yes, correct.
So then that way you could, whatever emergency procurement and funding can be leveraged for one larger purchase.
Yes, that is how we're looking at it.
Okay. Okay, Eddie, you want to go over your PowerPoint?
Yeah, thank you, Senators. Thank you, Chair. Just really quick, I won't go through the whole PowerPoint, and you have it there with you. And Scott touched on a lot of points, and I just want to, kind of give credit to Scott and Harold and Laura, because when this first started, we kind of got together and said we got to get together and figure out how to strategically approach this so that we're not all kind of going in different directions and kind of so that we can coordinate coordinate our resources. So I think we've really done that. I feel like if you look at kind of the things that we have done in relationship to the website, bhhsurge.hawaii.gov, which first and foremost provides as much information to as many people as we can, and that it's unified and universalized as much as possible throughout the different kind of funders that are included. Myself from DOH, Scott from Governor's Office, and then Harold, and then also with Laura involved in it, then it allows us to really kind of get information out to the many providers in a coordinated way. And then if you look at also, as you were talking about, Chair, the idea of taking a strategic approach to looking at what kind of resources we need and how we can disperse them. We have one of the components on the website that we developed early on was a statewide inventory of needs that the different providers had, where they could just go on the website and fill in a form, and then we take all of that information and we aggregate it so that we have a very good inventory of what we're trying to get to folks. We're still working on trying to get that supply chain happening, but we know exactly kind of what people need, and it can be updated as we go. So there's no limit to how many times providers can put the form in. So we also, in conjunction with that, really excited to talk about the partnership that we have with the Hawaii Community Foundation that was just launched today. It's actually going to go live today, which we're calling Resiliency Hubs, where we're working with Key Project, the YMCA, and a couple of other partners, in addition to Hawaii Community Foundation, to create these drop-off sites where the public can donate supplies and homemade masks and things like that. Then we collect them and then we distribute them based on the assessment that we've done. We also have the weekly calls that Scott talked about, which I think have been really helpful in getting the word out, that people know that every Monday at 11 o'clock we'll have the call. We have different speakers come on. We talk about the latest updates, that kind of thing. One of the things in the background that we're doing is we have teams that are looking at all of the different websites, Health and Human Services, CDC, World Health Organization, CMS, other federal partners, and they're looking at those websites on a daily basis during the day, taking that information and synthesizing it so that we can put it up on our website so people don't have to go through all of these different places to find information, because as you know, this stuff is changing every day, and so every day almost I would say in the last week you've seen CDC has kind of updated their guidance, and so what we want to do is stay on top of that as well. And then the weekly provider calls.
You know, on your distribution center, so you're having the drop-offs in certain areas.
Yes.
So when Scott talked about the portable sinks and toilets, are you going to be clustering all of the activities so that they have restroom, testing, distribution? Actually,
kind of the opposite, Senator. So the drop-offs of the supply and PPE drop-off sites.
No, but when you distribute it to the homeless.
Actually, we're distributing it to the providers so they can then utilize it both for themselves and for the populations that they're working with. So that's where that tree happens, that kind of tiers happen. So we get it to the providers.
So what do you cluster around the hygiene facilities? That would at least screening. You would think they would have to go.
So bathrooms and showers, so they're congregated.
Exactly. So and that's where the providers would come in to do, because they're the ones that are boots on the ground, front line, and so that's where we're trying to use this kind of mechanism to find out exactly what the providers need. I will say that the testing, the going out and testing piece is a little bit tricky, because from an infection control standpoint, as soon as we test someone, we have to quarantine them. It's just it's public health kind of mandate, right? And then the big question is,
we know,
where do we You guys know, you guys got quarantined yourselves, right? But you guys had a place to go to quarantine, and so the question is, once we test somebody, how do we quarantine them? And that's why the Kahi Street Isolation and Quarantine Center is so important, and for us to be able to duplicate those in other counties and in other areas across the state. And I think that's the ramp up that we need to have happen as soon as we can. I think we've done a pretty good job of getting the first quarantine shelter up and running in like Scott said, under 2 weeks. But it's again, using resources that are available to us now.
But so let's say, because in Wahiawa around Lake Wilson, there are homeless encampments. They're not going to go all the way to Kaka'ako to be quarantined.
Yeah, that's where we're going to need to have additional sites, and we're looking for and identifying additional sites. I just met with the city. Scott and I went to look at a site yesterday that would be potential, but there are other potential sites that we could utilize, and some of them.
I would think same for North Shore, same for Waianae Coast.
Yeah.
I can't.
Yeah. So that's to follow up on that. That's the letter that I sent a while back to the governor, and I was talking to the general about, because that was the recommendation from the community a while back. Why we don't set up these hygiene places that the homeless can come, get hygiene, provide masks and everything for them, even if they're not going to stay in the tent or the area. At least they have some place to come, wash up, use the bathroom, shower, get some hygiene things to go back wherever they stay. But at least they're having some kind of monitoring of where these areas are. And then again, the reason why I brought it up to the governor and the mayor was to have the general get the Coast the National Guard to put up these tents in the areas that either Senator Donovan or myself or other senators in their districts can identify the areas where they're going to come and be able to do it. Like he said, nobody from Wahiawa is going to come into town and say we have a beach. Right. But if you have some place that that HPD can say, hey, there's some place over here by Leleua High School, you can get hygiene and clean or whatever. At least that's going to give them some kind of direction to where to go. And right now, we just don't have that place. And it would be good to start looking for that in the near months before somebody gets sick in the population of the homeless, and then we will be all jam up.
Yeah, you're exactly right, Senator. We'd like to have that up and running yesterday. I mean, the idea is to bring those services, like you're saying, especially for those encampments that may be pretty stable, where those folks are going to stay pretty much where they are, is to bring those resources to them, bring the supports to them, and try to contain that movement. This is a vector control issue, right? Yeah. So if you scatter people, then you're just moving everybody into different places. So we're completely supportive of that idea, and we want to kind of continue to find places that we can do that with.
Yeah, I was thinking North Shore, like I said, Windward Oahu, Leeward Oahu, Waianae Coast.
Yeah. I did put in this week, I did put in a request for assistance to Haima for a pretty significant number of portable units that we can utilize across the state, that are those kind of, that we can just set them up and then create that centralized, those hubs.
But do you have providers going out there, like Senator Murakami mentioned, actually, like there's lots of clusters around Lake Wilson, right? There's lots of clusters probably in sections of the North Shore. Probably
Laura can talk about.
I guess, is that something that Laura's going to address then?
Yeah, and those are the real, to me, those are the real soldiers in this. I mean, from a behavioral health care standpoint, in this situation, we got the medical team, the medical staff that are the real soldiers in this crisis. But there's also a lot of folks that are out there, behavioral health, homelessness, that are going out and kind of doing what they on a day-to-day basis as well. So
yeah, because I think there is a concern that let's say there is an outbreak and they end up going to, if we can prevent that versus them having to go to Queens or Wahiawa General or Queens West, and then you end up only compromising the situation even more because you have more people who may have it.
Yeah, so right now the way we have it is we have two referral funnels and that's in your packet. One is through the hospitals, which we hope that once they get to the hospitals, because they are going, most of the referrals that we've gotten have been from the hospitals. And once they get to the hospitals can assess and determine whether or not they should be swabbed. And then if they're swabbed, they come to our quarantine site. And then the second pathway is through the Hawai'i Cares number. But we have to expand that, I know, but this is the start that we've kind of identified, because we need, again, like you said, multiple quarantine and isolation sites, especially for homeless. We did a kind of almost a quick and dirty kind of assessment for DOH in terms of if there was a surge, how many additional beds we would need, not medical beds, but just quarantine and isolation or beds for homeless folks. And we're looking at about 600 to 800 beds across the state that we would need. Those are individual sites that we might need. So
what's required at your quarantine site? I mean, you have the Ka'ahi one.
Mm-hmm.
How many, is it beds? And they have to be isolated? What are you looking at when you're setting up these quarantine stations, I guess, or quarantine sites?
Yeah, good question. Thank you. So from a medical standpoint, if somebody's been tested, like you guys were tested, and they're awaiting their results, we have to keep them away from anybody else, because if we put patient A who just got tested and patient B who just got tested, we don't have the results for either of them together, and patient A is infected but patient B wasn't, then those two now have just infected each other. So first and foremost, if we're awaiting the test, we have to keep those guys isolated or quarantined in a space where they don't have to come into contact with anybody else but the healthcare providers that are working with them. Once we identify that they've tested positive, then we can isolate them, but we can kind of cohort them a little bit better, because you can put a couple of different people who have tested positive in the same unit. So Ka'ahi Street has 26 individual apartment units. Each of them are about 2 bedrooms. But because we have to quarantine first before we isolate, we're using some of those units as quarantine units, where we just have one person in there, because that's infection control CDC guidelines. Once they identify as positive, they go into another unit where they can then isolate and wait out until they're medically cleared, and then others can go into that space as well, and so we can kind of cluster those. So that gives us, for Ka'ahi Street with those 26 units, probably in the neighborhood of 50 beds total that we can utilize if we were completely full once we get to that point.
So how do you identify these homeless? So they would have to be coughing or fever, and then they get sent to the hospital, or how do you pull them out so that they can actually get to your testing and then quarantine?
The providers are going out.
Providers are finding
people. Yeah, so if the providers go out and they see somebody who's symptomatic, so when we first started this, and again, guidelines have started changing every day, right? But when we first started this, we were targeting symptomatic, homeless, underlying health issues, because we were looking at the highest risk. So if the providers go out and they identify somebody who meets that criteria, they just call the CARES line, and then we do a pre-screening to determine if they should go get tested. For right now, we're asking them to take them to get them to the hospital, because that's the best place for them to get tested. Once we set up more mobile sites and stuff like that, or we have testing on site, we're not going to do mass testing on site, because what you have then is you have a bunch of people congregating, potentially who are infected and being around each other. But if we can control that and manage that so that we're doing good infection control standards, they can come down to the site and potentially get tested. So we got 2 ways to do it. One is through the ERs, or the standing testing sites that are across the state, or we have them come down to the Ka'ahi Street site. But we got to manage that flow very tightly so that we're not increasing the risk that others get infected, especially our staff that are working down there.
Okay, quick question before we hear from Laura, because I know she's been waiting. Kauhale Village in Waimanalo. They're on a DLNR parcel, right? Are they permitted or unpermitted?
I honestly, Chair, I don't have any details in terms of how that.
Maybe later Scott can, if he's hearing the question. Just wanted to make sure if they're permitted, just making sure that they do meet basic health and safety.
So, Chair, this is Scott. The DLNR did not give approval for that current use on the land, and the community members that did initiate the kohale do not have any type of land disposition with DLNR for that property. DLNR has been in communication with the community members who are initiating the kohale and are and did ask them to cease in putting up any additional structures on the property or taking in any additional people. I think that there was some concern that that property is in a high-risk flood zone.
Senator Kidani.
Thank you. This question is for Senator Lorraine Inouye, who's listening in, I'm not sure, on Olelo 49 or YouTube. But she wants to know, you talked about reaching out to the hospitals. So do the hospitals also let you guys know when they're discharging the patients? And this goes back to how, particularly at Queens, because we're here and we see them all the time, they're on the corner there for sometimes a week. There was one couple that was there about 10 days a couple weeks ago.
Yeah, so there's two, again, we're looking at two kind of separate kind of categories. One is the category that Scott talked about, where if they're homeless and they are have not necessarily been tested for COVID, and they're not suspected as potentially having the virus, then they would go through the normal channels of alerting the providers that Scott talked about. If they have been tested for COVID, we're working with all of the hospitals to call us and identify that they have tested an individual and that person is unsheltered, and then we coordinate and facilitate them getting to the quarantine shelter straight from the hospitals. If on our website we have the there's a tab that just talks about quarantine and isolation, and it has the protocols that we follow that we've established, and that's for both the hospitals and for the communities who are community folks, providers, and others that are looking to refer somebody.
And you could require them to go to the quarantine, the shelter. I mean, because if they don't, do they get arrested? Or, I mean, how do you monitor that if a person says, I don't want to go?
If they do that against medical advice, our policy is to alert the Honolulu Police Department, all of the other emergency hospitals on the island, as well as our disease outbreak control division, so that everybody's aware that we have somebody who's kind of walking around that's been tested, and that we need to kind of identify who that is.
So they're not isolated. There's no effort to isolate them and not have them go around.
There's an effort to isolate them and be able to kind of get them facilitate them getting from the ER to the quarantine center. But if somebody flat out refuses to go, we don't have the enforcement ability to force them into the quarantine center. We could potentially, we've been discussing this idea, we could potentially do on MH1, but we'd have to really work with our AG to identify whether or not that was an avenue that we could go through.
Even with the governor's proclamation saying we're in an emergency situation, you've got to contain people who are positive and not have the spread. There's no authority to make them go to quarantine and have them.
Well, I think the entire state's struggling with that, and not just necessarily with homeless folks. I mean, we have regular people still going to the beach and hanging out and stuff like that. So I think, honestly, that's above my pay grade.
Senator.
I guess what Senator Kadani was saying, and besides the virus, we've been having, what she's saying is when homeless are checked out or released from the emergency or the hospital, do they notify the agencies to let them know they're possible going to be released and they have nowhere to go instead of staying on the street for 2 weeks? Is there a way of the emergencies or the hospitals are notifying the agencies and letting them know that we had released a male, female, whatever, and they're out here? Do they have a way of doing that?
This is outside the COVID-19.
Yeah, it's outside of COVID-19.
Outside of COVID, so pre-COVID, I think a lot of you may have heard us talk about this pre-COVID. So outside of COVID, what we were trying to develop was a coordinated one-stop call center, the Hawai'i Cares system, which is the coordinated access, resource, and entry system. And we were trying to do that so for exactly that reason, so that we would have a system where we could track folks that are coming out of the hospital so that they're not being discharged and kind of sitting across the street in their wheelchair. Senator Kidani, outside of Queens, who I see also every time I drive into my office parking lot. And I think that we were getting there, and I think that honestly, COVID has actually advanced that and kind of leapfrogged that, because now we have a mandate to start to bulldoze the administrivia and the silos that we have been struggling with in the past. And this is a real opportunity to set up a system that even post-COVID will work better for behavioral health and homelessness. That's a long answer to saying not necessarily a standardized way of doing that other than what Scott talked about, but I would add that our CARES operators, 832-3100 is also a number that the ERs can call to see if we can try to facilitate support services for people that are not COVID.
I think the question is there a procedure? The hospitals have your contact numbers, and when they suspect this is a homeless person and they're going to release them, do they contact you guys? And particularly now during COVID, people on the street, homeless or not, they help each other, and I do see people trying to give them cigarettes or whatever, and if they don't know if they're infected, it's just another way that this is spreading. So I think my concern is for the COVID right now, but after this, is there a way that you guys are working with the hospital so when they're ready for a release, somebody's notified?
Yeah, and thank you. So short answer is they can call our number, the CARES number, 832-3100. For COVID, there is a protocol that we've sent out to the ERs and that we're working with the ERs to do for COVID. For non-COVID, and they will have been tested or they will have been screened if they're in the ERs, if they're homeless, and the ERs will make that determination of whether or not they should have been tested. And if they release them and they have not been tested and they are homeless, they can still call the 832-3100 number. And we'll try to work with Scott's office and Laura's folks to make sure that we get services for those people.
Thank you.
So just want to, right now going forward, I know we're not to this point, but I've been getting suggestions here about, like in Kapolei, we have Kmart, who have people staying on the outside area. We have big buildings like Kmart. They put up a tent, the one that we have at our Civic Center in Waianae. I'm just saying we're to a point that we're going to try to contain this with our homeless and our houseless population. When are we of all of us is going to come to a decision that we're going to need to take these steps before they get infected and start spreading it. So to do a proactive approach and start bringing these guys in to certain areas to making sure that they don't get, like how Senator Kadani just said, the guys over here, they bring them food, they give them cigarettes, they give them money, they even give them on the canvas. I mean, we're to the point that they're going to start getting the disease or whatever virus, that we're going to start spreading it among not only the homeless but in the cities, the different cities, because they all catch bus. That.
I'm Senator. I'm right there with you. I mean, we all know that homelessness was a major issue pre-COVID, and COVID has just exacerbated the need for us to have better resources, more resources for this population, both for homelessness and behavioral health. And so I guess the question of when are we going to all get together to figure out, what the strategy is. I'm ready. I feel like from the Department of Health standpoint, we've been as proactive as we possibly can be to get stuff moving as fast as we can, and I'll take any support I can get.
Laura probably has some insight into that too. Yeah. So why don't we just transition to Laura? I think you got to unmute though, Laura. Laura, you got to unmute. You see the red phone? Yeah. Okay.
Yeah. Can you hear me now? Yeah. I was on my phone too. I'm listening through my phone and talking through my computer, so I apologize for that. Since there's been a lot of questions, and I'm hoping I'm going to be able to answer some of the questions that have already come up. And directly in response to what's going on with Queens, we do have a relationship with Queens, and they are a significant part of our coordinated entry system, because we do recognize that people are being discharged from the hospital without a plan. So we have a very good relationship with them. We also have a very good relationship with MedQuest and the State Department of Health to make sure that we streamline those processes. So we do have that in place. As always, we need to improve things as we go. A couple of the other things that I wanted to just draw attention to. Yes, the bathrooms were a huge issue, both at the city and at the state parks. Unfortunately, a lot of the city parks are still closed. And just for clarification, we're going to be seeing a lot more people physically on the street and on the sidewalk, because even though people may be able to access the bathrooms, they are being actively removed from the parks. The only encampments that have been able to remain in the general location of the parks is basically Waimanalo. Other than that, you will see a lot more people physically on the sidewalks. And I know Senator Moriwaki, you contacted me about folks in the Ala Moana area, and that's why that's happening. Those are not necessarily new homeless folks. Those are just folks that were kind of hidden in the parks and were not disturbed on a one-to-one basis. But now that they have actually physically been removed from the parks on a daily basis by HPD, we're going to see a lot more of that happening. In regards to the hygiene centers, although I understand the idea of wanting to put a hygiene station somewhere and have people come to it, we are very aware of the potential for contamination at that point. So what we are really striving for is continued outreach as it is and has always been. So our outreach workers have the best relationships with folks that are homeless. Also added on to this is the complication of mental health issues. So, a lot of our folks don't understand what's going on and don't understand the ramifications of congregating. So a lot of what our outreach workers are doing and really working on is educating folks on what the situation is and educating them on social distancing. This isn't an easy concept for our folks that are homeless to understand. And so we really need to encourage and empower the outreach workers to continue the relationships that they already have with those folks who are homeless, and make sure that they are continuously educating those folks. what we're really looking at is a three-pronged approach here, and I think you guys have hit the nail on the head with this. We're looking at the immediate response, what our actions are going to be during this crisis, and then preparation for life after the crisis. So a lot of our stuff is still ongoing, and it's business as usual for a lot of things. And we want to encourage that for the most part, because at some point this crisis is going to be over, and we still need to be working to get more housing online and other programs that are necessary for our folks. So, we wasted a lot of time, unfortunately, at the beginning of this crisis, fighting for those bathrooms to be opened. And that unfortunately caused a lot of problems within our parks. And so we're working on repairing those relationships. We need more of those bathrooms to be reopened. And as much as it's our goal to get the community involved in that process, it's also part of the responsibility for the city and the state to make sure that there's resources available. So that's a challenge for both sides, both the community and the government. We, as Scott and Eddie have talked about, we do have the Survey 123 app up and operational. This is going to be really key for us as a system to really look at where the issues are, where there's groups of folks who have underlying conditions that may make them more susceptible to COVID-19. We need to focus our attention on getting services out to those folks and do it in such a way that we're abiding by the CDC guidelines and making sure that those services will be ongoing to those folks. Makes no sense to test a group of people if we're not going to return and give them the results and make sure that they're social distancing. So we want to be very cognizant of those kind of activities. On a very good note, both the state and the city have relaxed some of the performance measures within our contract to enable us to not have to meet certain guidelines of our contract so that we can actually deal with this crisis as it's going on right now. I think the biggest thing that we can take away from this is the relationships that we're building. We had a lot of stuff in place. A lot of the time we didn't have enough people at the table, or we didn't have the right people at the table. Right now we've got a lot of the right people at the table, so we need to continue this kind of communication and collaboration after this is over. The constant communication with our providers is really paramount in this situation. And then in regards to after this crisis is over, we're going to see, I assume, a big jump in the number of folks who are experiencing homelessness. And that's simply because there are too many people that are on the edge of homelessness. So we have got to start now developing our exit strategy to move people into permanent housing even during this crisis, so that when this is over, that we've got more ability to work with the new increased population. I wanted to, let's see. Yeah, we're not seeing a huge influx of folks coming into the state that we know about that are homeless. I know there were a couple that were immediately returned. And so I think it's more we're dealing with the folks that are already homeless. One bright light out of this is people who have been very resistive to going into shelter have started to reconsider their options. And this is a great opportunity for us to really build that relationship with the outreach workers and the housing programs, so that it's often I was an outreach worker for years. If we can get a person to agree to shelter today in this minute, if we can get them into shelter, they're going to be better off. An hour from now, they might decide they don't want to go. So if we don't have things available to them, that's going to be paramount. We are continuing to house people even now. So despite what some people might think, we actually are housing people. We have to be very creative with our landlords. We have to encourage them to let us show properties if they don't want to be there, figuring out how we can coordinate with them to get people into housing. The more we can help people quarantine in place in their own units, the better we're going to be at preventing the spread of COVID. I know we are actively working right now to depopulate some of the congregate shelters. That's my biggest concern. Because if we get the sickness in any of these congregate shelters, it's going to be very difficult to stop the spread. So we are actively working with the state, DOH, HPO programs to move people into transitional shelters that are available and to continue those services going forward because transitional shelters, a lot of them have individual units. So with that being said, that's kind of the main points that I wanted to address that have come up already in this hearing. I'll answer any questions that I possibly can. But the biggest thing for us is allowing folks to shelter in place as much as possible and maintain the social distancing so that there's not a spread.
Thank you. You answered a lot of the questions that we had, so I appreciate it. Appreciate all your guys' efforts in dealing with this situation. I know it's only made it even more difficult. You had any follow-up question?
Thank you for that. I understand, but see, the problem in my area where I live in Ever Beach, the city and county made this virus pandemic an excuse to shut down our parks. There was no need to shut down our parks, and they never reopened it since, even though they said. So I talked to some of the people that work and live in the community that works for the parks. This is their excuse to close some of the parks that they had a hard time closing prior to the pandemic. So that's the thing that we got to work with the city. Is that what's more important right now, closing the parks or having somebody be able to use the bathroom in the toilet or on the side of the road? Because we have a guy right now in 7-Eleven, he's been there for 3 weeks. He doesn't move. So what do you think he's using a bathroom? Right in that bushes. So that's the kind of stuff that we need to stress not only to the city but to the people that are doing the outreach, because they're doing a great job. The outreach guys, their hands are strapped if the person doesn't want to go. He's a veteran. The veterans came out to assist him, but he doesn't move. He stays there for weeks at a time. Another one is, are you guys going to go, not only now, since you're saying in the future, are you guys going to work with DOT and the airports to prevent people who come in with one-way tickets from different states and countries coming here to make Hawai'i their home on the beach or in our parks? Because I know there was something called the walk and talk detail, and I'm bringing this up again a long time ago, and how we had stopped the influx of homelessness and drugs coming into our community through the walk and talk detail. But all of a sudden it stopped, and it stopped in the mid or late 90s. But if we're going to stop and regulate having outside homelessness coming to our community, we're going to need to stop them at the airport. And I tell you right now, the manifest is very easy. Could have your name on them, have no return flight. You go up to the person, they have no reason to be here, they should be sent back. Because right now, nobody's monitoring that at the airport right now. So you figure what the other states are doing, because we have an open airport coming to Hawaii. What do you think they're doing? Because the flights are cheap. They are saying, or maybe we don't have an accurate account because we have nobody monitoring them. But I bet you this, if somebody's monitoring them, we're going to know, have more than 1 or 2 coming into the state that we don't know about because we have nobody actually monitoring them. So in the future, and even now, can we work with the DOT in trying to monitoring these guys on the manifest and only have one-way tickets to Hawaii?
So are you just?
We're happy to work with anybody. We don't have the authority to stop somebody from coming, but I know providers, if we do find out that people are coming here and this is and it's not an appropriate place for them to stay, we work really tirelessly to get them back to the services that will actually help them in their home state. So that is very much a commitment of ours, but we have no authority to make them move, just like we don't have authority to pick somebody up off of the street unless a court order or an MH1 mandates that they are a danger to themselves or others, and that is an extremely high measure that we often are not able to get a judge to order.
And if I could add, Chair and Senator, I do think that at this point, both the DOT and General Hara are taking that issue very, very seriously. I was just on a call, I think 2 days ago, where General Hara was discussing that issue. And I think maybe for aside from some well-advertised folks that came in very early on, I think we've been able to stem the flow a little bit. I'll double check with folks at DOT and Hawai'i, but I do think that that's being done right now, actually.
Okay, thank you.
Okay, so if not, if we don't have any further questions, we really appreciate the three of you, your efforts, and all the partners that you guys have been working with. So thank you very much.
Thank you very, very much.
Thanks, you guys. Appreciate it.
Just one more, the numbers that people can call when they see homeless on the streets, mental health, as well as just someone, disturbing.
Maybe
Laura, do you have a phone number that people can call? What is the number? The hotline number?
I mean, just for anybody who you find homeless on the street.
Yeah, if they're concerned about.
There's not a true number. So most people just call my office number, which is 543-2282. Between myself and our entire membership, we pretty much figure out who can follow up with them. And just as a side note, we have over, I think, 10,000 people in our homeless management information system. The possibility that an outreach worker is connected with a person is very, very high. Whether or not that person will take treatment, that's a different story. But most of the people that people call us about, we can almost immediately identify and know that they have been touched by outreach and that they're either refusing services or they are getting services.
Okay, if I could just add, really encourage people to go to the website, bhsurg.hawaii.gov. There's a lot of really good information on there. Decision trees about PPE, decision trees about how to do telehealth, and information about how to access the temporary quarantine and isolation shelter center.
Thank you.
Thanks.
Thank you.
Thank you.
Thank you.
Thanks, everybody.
Thank you. Okay, so next on the agenda we have the Special Master. Are you on? Judge Foley?
Hello.
Hi.
Yes. Hi, Senator. Thank you for inviting me. I filed my report a little more than an hour ago, right before noon, and sent it to you, Dane, for distribution to the committee members. And then I followed it by sending you all the exhibits to the report. They're voluminous, so it's a little hard to do that. But it's a public document filed with the Hawaii Supreme Court. Just a little caveat before we begin. I've been holding, so I listened to the last couple of witnesses and exchange, and some of the comments by the senators I didn't fully understand, so there could be an audio issue. So I apologize if a question is asked to me and I ask it to be restated. One thing to keep in mind is I was appointed special master just a week ago, and I was given a deadline of 1 week to investigate, make findings and recommendations, and file a preliminary report. So when you read the report, keep that in mind. There were tremendous time constraints, and so not all issues maybe are being addressed as they should be addressed in the future. Let me tell you what the report is, and when you pick it up, it begins by describing the local correctional facilities, the jails and the prisons on every island, their population, their configurations, and that's important, dormitory, double cell, etc. And one of the documents referred to is the Population Management Commission report filed in 2001. That commission was created pursuant to a federal court consent decree between the ACLU and the state at the conclusion of monitoring the Oahu Community Correctional Center, the Women's Community Correctional Center, where conditions were challenged by the ACLU as unconstitutional. And some of the conditions concerned health, and the other was setting a population cap and mandating the state get below that cap within a certain period of time. Now, the coronavirus is a much more serious issue than the issues back in 1985, and the time constraints are more severe. We had a year or so to work with the state in reducing population. It seems much more urgent at this time. The report then goes into summarizing all the proceedings, the 2 petitions filed by the state public defender and the responses by all the various parties, the prosecutors of the 4 jurisdictions, the Attorney General, and then some amicus curiae briefs were filed, one by the ACLU and the other by a group of national health experts represented by Eric Seitz. So there's a brief summary of all of those proceedings, so you don't have to go and call through each one, although they are online, but not attached. Then the next part goes to the summary of conferences led by the AG. This began before I was appointed special master. At the urging of the Supreme Court in terms of an interim order, the Attorney General took the lead and convened a working group of the 4 prosecutors, the public defender, its office, and brought in key players, Department of Public Safety, Hawaii Parole Authority, the Probation Department, and others that were impacted. And they started working in a very collaborative fashion to identify inmates that could be released consistent with public safety. And this working group has met 1, 2, 3, 4, 5 times. We met this morning, which is not in the report. And so by going through the summaries, you can get a good idea of this collaborative effort and some of the issues raised. The review on the population, the reduction of the population, is essentially being mandated by the Hawaii Supreme Court. And clearly, as you know, people have different views on whether that should be done and how it should be done. And as the Hawaii Supreme Court put in its order appointing me a week ago, public health issues and public safety issues should be considered in balance. Then we get to a part 3. Because of time constraints, and this is an ongoing process, I invited the 4 prosecutors, the Attorney General, the Public Defender, to submit reports for inclusion in my major report, and all but the Honolulu prosecutor did so. And reading those reports, you'll get a good idea of what the various positions are and how at least 3 of the prosecutors, the Attorney General, the Public Defender, think this process should go or not go for that matter. And then there was unsolicited communication from a group of local health professionals. I put that in there. It's somewhat abbreviated. But then there's one I really ask you to take a look at. I didn't know this person, but there's a Dr. Pablo Stewart. I didn't include his CV, which runs about 30 pages, but he's a national expert. He's a psychiatrist in conditions in jails and prisons, and has actually been working in OCCC. And it's just a very short letter, a couple of pages, but it really gives you an insight, and I have no reason to second guess, you may, but not me, what he thinks the problems are in terms of the pandemic entering OCCC and spreading, and the inability of the department to confront and contain it. There may be similar, and I'm sure similar issues at least the other CCCs. The Hawai'i Medium Security Facility, the Waiava Minimum Security Facility, and the Kulani, that's entirely different configuration and set of issues. I then get into part 4, the process I went about in investigating and writing this report, and they pretty much started simultaneously because of time constraints. I was assigned a former law clerk of mine, Dalen Gibson, from the judiciary, spectacular, to help me write it. So I told her while I was doing my investigation, write the background part, and Brandon Kimura, who had been sitting in all these meetings of the stakeholders, please write me a summary of all the meetings. You'll find that in the report at the beginning. It's primarily their work. I couldn't have written a comprehensive report without their assistance. The first part under observations and recommendations deals with the Hawaii Corrections Oversight Commission created by the legislature. And they wrote a letter to the governor. The governor responded. That's a huge, through public safety, that's a huge an exhibit of about 100 pages that includes the pandemic plan, disease control protocols, their efforts to prepare to meet and contain the virus. That's in one of the exhibits. But the Oversight Commission has looked at it and thought in questions, in all honesty, the department's ability to do what they would like to do, and is requesting additional information. You'll see that in my report, particularly when the virus comes in, where do you quarantine an inmate? How do you react? Do you have the space? Do you have the resources, facility by facility, so they can really see how prepared the department is? Another big issue in that section are the operational capacities. You'll see in one of the exhibits, fairly current, at the end of March, I forget, March 30 or 31, how many days we have, the actual count facility by facility, by design capacity, by operational capacity, and by actual population as of a day or so ago. Now, the operational capacities were set in 2001. Coronavirus and pandemic was not an issue. And so the Oversight Commission has requested the Department of Public Safety to work with them and to review the operational capacities and move them downward, not permanently, but at least in order to fight a pandemic, to respond to a pandemic. And you'll find that in the report. Then we get to my observations and recommendations for this stakeholder group, the 4 prosecutors, public defender, and attorney general. And one of the things I think we need, and I'm recommending, we're now getting, everybody gets a monthly report, as you'll see attached. They think they should be bi-monthly. This thing has the potential to move so quickly. People would like a little more update. There's also been a problem of information from the public defender's office. As you may know, in documents you reviewed, there was an interim order by the Supreme Court before I was appointed special master for the public defender to send to the prosecutor a list of sentence misdemeanors, sentence petty misdemeanors, sentence probation felony, and pretrial detainees to basically start seeing which one of these individuals, we're not talking groups, individuals, were candidates for early relief. The public defender didn't have complete and accurate information because they were relying on public safety. So a lot of the lists were inaccurate, which resulted in prosecutors issuing blanket objections. They didn't know who these people were. And courts having to spend an enormous amount of time that they don't have getting the name, going into their database, trying to find out who this inmate is, what they were charged with, what they were convicted with, what court they were under or are under as far as jurisdiction, who was the sentencing judge. And I'm recommending that when the public defender puts someone on the list, they work with public safety to make sure it's accurate. Also, some of the people on the list had already been adjudicated for early relief, either yes or no, and judges had to find out, well, we've already done this. Nobody has enough time. We shouldn't have it.
Can we summarize?
Is there a question?
Go ahead. Okay, can you quickly summarize the rest, and then we'll have the members ask questions then? Or are you at the end of your presentation?
Okay, I didn't quite hear that, so I'll move on and then open it for questions. One of the big issues, I'm mindful of communications. As you'll see, I've received from the House, the Speaker, and a number of House members their concern, not sent to me directly, but sent to the court, copying me our concerns expressed by the Honolulu Police Department, the mayor of Honolulu, and members of the City Council. And what is ongoing now is not block release. What is happening right now is and it works differently. In the neighbor islands, Kauai, Maui, and the Big Island, where the populations are smaller, inmate populations, where the culture is different, it's a much more collaborative effort where prosecutors and public defenders are working together to cull through these lists to see who they don't object to or who they would consent to with certain conditions for release, or others they think are inappropriate under any conditions. And this seems to be moving smoothly. It's more contentious in Honolulu. It's a larger population. The demographics are different. The culture is different. I've been around for a while through prosecutors from Charles Marsland, Kaneshiro, Carlisle. I don't think it has anything to do with particular people holding offices at this time. There's just a lot of different issues for Honolulu. It is moving, but differently than it's moving, but it's going to be my strong recommendation that anyone who goes through an individual judge, and the process can vary from island to island based on the culture, based on the process, but the judge is the gatekeeper. Nobody leaves without that judge saying, okay, and under what conditions. That's the way it's always been. That's the way it should be, and we're just trying to expedite this process because of current conditions. Along those lines, when you look at the population reports, and I know
we have one question. There's a question.
People are alarmed at people being released. Well, if you look at the latest population reduction, it's over 500 inmates in the last month.
Okay, well, we have one question. There's a question. Yes. Okay, go ahead.
Okay, with all that being said, the process of releasing our incarcerated families that is coming up, what is the process what is the process in going forward? Because I mean, we see what you have here. We have everything that you've written to us here. But what the public wants to know: where are these inmates when they leave prison? Yeah, not just because of the corona pandemic, but in the future. Right now, we're using the pandemic for a lot of reasons, for do a lot of things. But we need to make sure that this thing stays consistent. So when they get released, we have a lot of clean and sober homes, and a lot of I don't want to use the word halfway houses, but we have a lot of facilities out there. But it seems like there is a big disconnect between the prison, the paroling office, and even the judges. There's anything that you guys are going to end up going together and getting through these clean and sober coalitions and people that provide homes for the outcoming inmates in the plan? Because going forward, you guys talking about now, you guys are going to release these guys who are really close to terming out on the long term, yeah? But you released them with no ID, no birth certificate, no social security, no address. Guess where they're going? On the street in our communities. And then guess what happens? They're going to re-offend, and then there will be an open triple C pending another trial. So instead of having a revolving door in a big circle, when are we all going to collaborate and get together, knowing that this is a crisis, not only in the pandemic for the virus, but an ongoing crisis, period? Because that should not be the solution. We understand, and we know because we've seen the prisons. We went. We know they're crowded. But this should not be the reason for releasing 400 people into a community when none of you guys have a clue where they're going to go. So are you guys coming up with a solution of knowing where all of these inmates and people are being released going?
Yeah, I think I got the question. The concern of prosecutors in this process is that inmates released have a place to go, can be monitored, and that the release is not inconsistent with public safety. And very mindful why a residence is very important, in particular, because we have the coronavirus running around and stay-at-home orders. So this is, Senator, the concerns you have just raised are being actively raised by the prosecutors when someone comes up for early release. Because of the culture and the population of the neighbor islands, they seem to be working together. A lot of the judges, let me back up. I've talked to every chief judge, every deputy judge. I know them. You speak in confidence. And they know these people. They've seen them. They know their families. They know the community. So prosecutors and public defenders on the neighbor islands seem to be working hand in glove to address the sort of issues you raised, Senator, as terms of release by release. It's more difficult, of course, in Honolulu, and the relationship is not quite as collaborative between the prosecutor and the public defender here, and it never has been. So one of the things I've been doing is reaching out and talking to people that are advocates for inmates, that are advocates for the homeless, and trying to put people together to find housing or temporary housing for inmates that come out. So all I can say, Senator, this is a work in progress, but the issues you have raised are raised every day by prosecutors and the Attorney General as this process unfolds. And they want those, the things you raised, addressed in conditions of release. And, in some cases, if it's not, the person won't be released. But that'll get me to the point I was going to go to, because it deals with, and I didn't quite hear everything you said. As I said at the beginning, the audio is not great, but some of the similar issues for letting out misdemeanors, petty misdemeanors, sentenced felony probationers is also with the pretrial detainees. And that goes to a couple of things. One, I was beginning to say before the question was, where does this 500 plus inmates downed in a month come from? Well, some of them have just served their sentence and leave without any reduction. That happens every day. Well, the reason why the numbers didn't go down before is because every time an inmate left, another one was entering the system, so the high numbers remain pretty constant. Well, there are a number of things being done on the upfront side. Is one, to a certain extent, not all, but bench warrants are being suspended. You know, if you didn't show up to court on a particular day, they issue a bench warrant and they go look for you and find you and drag you in. That stopped, with the exception of people maybe they consider a dangerous offender on the street. So that's bringing less people in. Although the issue of cash bail has been discussed in the legislature for a number of years, every circuit has a different practice, and they've kind of stepped it out to keep inmates from coming in if they can stay out consistent with public safety for two reasons. One is the population, and the other is bringing possibly the virus. And as you know, because you've studied this issue far more than me, certain individuals, whether they're staff working in correctional facilities or inmates coming in, despite the attempt to screen, some are asymptomatic, they're going to come and go and infect people in the facility, and that won't be stopped. So they figure the fewer inmates coming in, consistent with public safety. So they've been employing more than they have before, release on own recognizance, supervised release. I think there's one circuit exploring unsecured bond. You're familiar with that. It's how the feds do it. But prosecutors also are having their input on conditions of release. And again, some of these conditions address the issue Senator just raised. So there's a number of factors going with this reduction of population. And these people, you know, are really conscientious. I know these judges.
Okay, can I just interrupt? We have another question from Senator Kyoho Kalole.
Thank you, Judge, and thank you for your work on this. I might have missed it, so can you just please reconfirm the timeline on this? At what point does the judiciary make a decision on your recommendation? And then at one point, if they accept your recommendation that judges review before release, at what point does that all happen?
That's an excellent question, Senator, and that goes to my report. And because of my short timeline to investigate and compile and submit a report, I think it's absolutely paramount, and I'm recommending this to the court, that they do not act on any of my recommendations until the stakeholders have an opportunity to respond to my report, to respond to my recommendations. How much time the court will give for that, hopefully they will give it. But Senator, I haven't discussed this matter. You know, I'm communicating to them through my report, which you'll have an opportunity to read. But the sense I get, this is going to move quickly. Now, it doesn't mean they're going to issue block releases. I'm recommending against that. What I'm recommending is this collaborative process described in the report that I think reasonable people acting in good faith, mindful of public safety, should continue. Along those lines, you may have been informed already.
When is your report due? Excuse me, pardon me. When is your report due? Thank you.
It's been filed and sent to your committee, but you've been in meetings all day. So
that was a preliminary. I've seen it. That was a preliminary report, is it not? So you don't have a final report and okay. So there is no on when a determination. Okay, thank you.
No. And so I submit my report. The court's going to respond, and then I'm going to find out what more they want me to do.
Crazy.
If anything, do they want me to submit a second report on what? So I'm with you, Senator. I'll find out as we move along.
Okay, so just to reiterate then, no actions are being taken until the court reviews your report and then decides what they want to do next.
That is my understanding. And before they decide what to do next, I think there should be a period, and hopefully they'll invite comments to respond to the report before they act.
Okay, Senator.
But I think it's going to be relatively soon.
Okay, Senator Kim has a question, followed by Senator Moriwaki.
Thank you, Judge Foley. Just a quick question, just a quick answer, if you may. So basically, your report doesn't include anything on the specific release of individuals. Your report is an overall statement which we've had a chance to just glance through. But the actual decisions on each individual that's going to be released is going to be at the discretion of the court. Is that what we're hearing?
Okay, I'm not sure if I heard the question correctly, but the actual decision for release would be made for those that have been sentenced by the sentencing judge, the judge who would sentence that person to jail.
And then that decision, once the decisions on your report, as well as having heard from the prosecutor, the attorney general, and the public defender, all of that will be taken into consideration. And will the public be given notice prior to the release and the decision?
Again, I'm not hearing it clear, but the prosecutor's position, as Senator Kim, is that, it will vary from inmate to inmate. If you have someone, for example, sentence
No, I guess what she's asking is that when the sentencing judge,
I hear you much better, so thank you.
When the sentencing judge reviews the case to determine the release or not, who else is included in that decision-making process?
And will the public be
and will the public be given some notification?
That would be up to the prosecutor. The way it works is the public defender requests early release for an inmate. The prosecutor has an opportunity to object. One of the issues that the prosecutors have put forth, that if somebody is going to be released early, they want sufficient time to notify those that would be impacted, those that would be particularly concerned, let's say the victim of the crime.
So who ultimately decides that process?
The sentencing judge.
Does the sentencing judge unilaterally decide the process? Or is there going to be uniformity throughout the whole system?
No. It really sort of varies from circuit to circuit. All the four processes are a little bit different, pretty much agreed upon by the prosecutor, the public defender, and the judge. The most protracted and complicated and time-consuming process is Honolulu.
Okay.
Judge Foley, thank you. Just one clarifying question. So when this was reported that the 400 plus inmates would be released, there was a sense of urgency that these people were having to be moved out of the prisons and into the community, and that's when the uproar arose with where are they going to be placed, how are they going to be monitored, what's the charges. But you're saying that each one of these will have to go to their judge. So this might be a longer process than what was reported, that these 400 would be taken out of the prisons. Is that correct?
Absolutely, Senator, and absolutely. And I think that's really important that this report become a public document, accessible to the public so they can read it. Yeah, that's the process that's been ongoing. That's the process I'm recommending continue.
Thank you.
Okay. Well, we appreciate your time this afternoon.
And one more, Senator. I know you got another witness, but I was going to say it. You may not be aware of it, but it's in the report report that 100 inmates will be moved from the Hawaii facility to the Federal Detention Center next week, freeing up beds.
Okay, thank you. We appreciate your effort.
And last comment, if any of you, and I've given my phone number, I think, to Dane, any of you, having read the report, have any questions or comments, feel free to contact me directly. Any communication, if you choose, will be confidential.
Okay, thank you. I appreciate it.
Thank you.
Thank you. Bye-bye.
Okay, so we have Director Espinza on. I know he presented before, but there were some just last-minute questions based on what we assumed. No, I guess when we had that one meeting, yeah, the initial, and I think there were some assumptions made that the release was imminent, and so I think that's why we had Director Espinza on. Do you have anything you want to update on first before we have questions?
I'm here.
Yeah, no. You have anything you want to update on us first before we ask any questions?
Sure. A couple of things. I want to reiterate some of what Judge Foley indicated, that through the routine process and no mass releases of any inmates that would be responsive to the motions filed in front of the Supreme Court, between March 2nd and April 9th, the jail populations throughout the state have been reduced by 548 across the 4 different jail facilities. So the process he spoke of regarding judges reviewing individual cases, the aggressive use of alternate means of adjudication, the aggressive use of our ISC people and police in regards to alternate means of incarceration have been exercised, and with those efforts and no one being released en masse, like I said, there is 548 less people incarcerated in our jails today than there were on March 2nd. Secondly, the Supreme Court's decision indicated that inmates serving intermittent sentences, meaning that those who come in on weekends only, were to be dismissed of that obligation. And for your information, that included 9 people at the Hilo jail and 2 people at the Maui jail. That's all there is statewide. Effective this past weekend, those individuals are no longer coming in for intermittent sentences being served 2 days at a time. We currently have 94 inmates at the Federal Detention Center. We got good news that effective Monday, they will be accepting up to 100 more. The exchange of inmates between public safety and the Federal Detention Center had been suspended as of March 13th, and it becomes effective again on Monday. On a different note, I'd like to report that in the midst of this crisis, our Hawaii Correctional Industries program has ramped up a newly established work line for the inmates. About 70 inmates are working right now, producing upwards of 700 to start, and at peak performance, 1,200 cloth face shields to be distributed first to our institutional workers and our inmates, and then later to be made available to other state agencies who may be desirous of it. So those are the numbers I wanted to report, and answer any questions you may have.
Senator Morishige.
I don't know, and I realize this is a stressful time. You know, Judge Foley gave us this letter from Pablo Stewart, Dr. Stewart, and he was saying that this implementation plan, the pandemic response plan that you have published on the 23rd of March, noted that the hygiene protocols within OCCC were not being observed, and that people didn't have, there were filthy bunks and so forth. Can you address that and whether corrections have been made? Because this was a concern of why they wanted to move out a number of the inmates for social distancing, but also for the hygiene and for the social distancing within OCCC and MCCC especially.
Well, first I was unaware of the doctor's inspectional visit, so I don't know from where the observations came. I have not reviewed that report. I certainly will as soon as possible. We're attempting to implement all the social distancing and hygienic practices as recommended by the CDC and is documented in our report. Staff continuously remind us of those things, and we take everything as a constructive criticism, and that nothing can be done perfectly, but we're going to keep trying every single day at every one of our institutions. Again, I don't know whether it was anecdotal evidence or a personal inspection that led to those conclusions.
It was mentioning that you didn't have masks and gloves for your staff as well. So if you're in touch with IEMA, getting supplies to your facilities would be really critical for your staff as well as some of your inmates who they have close contacts with. So
I think the director mentioned that they have some supplies that they're about to distribute.
okay, so if you can get those supplies to your staff, I think that would be really critical if they don't now have them.
Well, as you know, generally we offer a certain amount of PPEs for our staff members on a routine basis. We're not in routine times anymore. Generally, maybe 8 to 10% of our staffing require PPEs because they're working with our physical health, mental health, or infirmary populations. In today's environment, everybody wants a level of PPEs, and the need for soap to wash their hands and hand sanitizers is multiplied by the hundreds of percentages. So we are attempting, like every agency, to adapt to these new conditions and provide all of the services and supplies we can to our staff. At OCCC, we've been overwhelmed with public donations of this sort, and I'm very grateful for it.
Thank you.
Hi, Nolan. I have several questions. The first question is, how many new prisoners come in on a daily basis or a weekly basis?
Those are the numbers that have been dramatically reduced over the past month. The numbers are very low at this particular time.
Okay.
So as we release people, less people are being brought in than previous.
Okay.
So that's why the numbers have been reduced by 548 over the past month. It's not that anybody who's been incarcerated has been miraculously released in response to COVID. What it is less people are being brought in because of the activities of the police department, the prosecutors, and the public defenders. And as the people get routinely released on bail or after finishing their sentences, they're not being replaced with new arrestees in even higher numbers.
Okay, so that's good. But are you able to then isolate them in an area because they're saying that these new influx of individuals could bring in the COVID virus? And right now, if you don't have the virus in there, and if you keep your guards complete with the right PPEs so that they don't transmit in case they're bringing it in, or new ones aren't bringing in, then hopefully it can be a safe place, despite the fact that they're in close quarters.
Well, the inmates who do come in are screened by the police departments before they're put into their individual cell blocks. Additionally, they're screened when they go to district court, and they also get screened, of course, when they come into the individual CCCs. We've had a couple of people who we suspected may have had COVID, and we went ahead and implemented the appropriate isolation measures. Jails and prisons in and of themselves are not very conducive to strict participation in social distancing,
right.
But the staff and the inmates are trying their very best, and will continue to do that.
So what kind of testing are you folks doing right now?
The typical battery of temperature first, the first and primary, subsequent questions regarding travel, and symptoms such as a cough or body aches and things of that nature. And again, those things are required to be responded to in the positive before we are granted an actual COVID test.
So how many tests have you folks given in your population?
We've only been prompted to provide 2 tests so far, and both come back negative. Those people were released from isolation.
So only 2 tests. And how many incidents of COVID positive have you gotten?
We've not had a single positive so far.
Not a single positive in the corrections facility.
So far.
Okay, I mean, you know, if you listen to what everybody's saying, it's like, oh my God, it's going to, you know, multiply. So as long as we try to exercise these good methods and safe methods, it's probably a safer place than releasing people out into the public if their term is not up.
I've seen others get in trouble on this particular line of commentary, and I'll stay out of it. We're going to continue to do our very best to practice all that the experts tell us to do, given the circumstances and the confined space we work in.
Okay, thank you. It's good to know. One last question before I let someone else ask. We appreciate the shields that are being made by your new work line. Can they also make masks? So masks, face masks?
What I have here are the cloth masks that they're making.
They're making that as well?
As we speak, 6 days a week they're working.
Fantastic. Now, the fact that they're making it, are you making those prisoners and everybody else wear them?
As soon as we issue them, we expect to take that option, yes.
So when will you issue?
A couple of the facilities have already been issued. Our medical unit has been given an initial delivery, and we expect to roll out to the rest of the facilities for staff first and inmates subsequent in the week to come.
Great. That's good to hear. Appreciate that. Thank you.
So thank you, Director.
Thank you.
I appreciate you taking the time.
Thank you.
Okay, so members, this concludes today's meeting. I guess for next week, Monday, we got requests to have ETS on the agenda, an update from Department of Labor on some of the questions to follow up. DHERD, and if Haima has time, then they can provide us any additional update, and then we can. Okay, yeah, okay. We can include the chief of staff. I know there were some questions for the AG.
There's questions about the filing for education grants. That's part of it, and that there's deadlines of when these applications have to be put in for each state. So I wanted to ask that.
Okay, no, we can have that.
Can we just ask for someone who doesn't have that?
And then we can have tax because they did the app.
Grown-up.
Yeah.
Tax.
So we can try to have those on. So we'll just add, we just have to add the chief of staff. So, okay.
Are we on?
Okay. So if not, this is adjourned, and we'll reconvene on Monday.